Hello, colleagues, friends, and welcome to the first session of the Primero Global Meeting. I'm very happy to have such a large group here today. It's very exciting that we've been able to get so many registrations for a virtual meeting. I want to just start quickly with some introductory rules of engagement here because it is such a large virtual meeting. We're gonna begin by explaining how the multilingual captions work. So we had a request from colleagues that we try to have multilingual captions implemented so that you can listen to or see the presentations in your own language. To do that, you can use the small menu at the top where you see more actions, the three dots. If you click on that and then you go to language and speech, you should be able to see an option that says show live captions. And if you click on that, you can select the language for the captions. So for anybody who wants to use that feature, it is available to you. I also want to let everybody know that this is being recorded. The full meeting is being recorded, and we are going to mute participants unless you're speaking, just so that we can avoid microphones accidentally being turned on while our presenters are presenting information. So we've shared all of the information with you about the meeting on the Primero microsite for this meeting. I'm just going to share that in the chat so everybody can see. This is where we're going to post all of the information, the sessions, the video, all of the content will be available here. I want you to take a click through that, make sure that you see the material there, our agenda, for example. And once we get one or two more minutes behind us, we still have people joining. We have a very special guest speaker this morning, and we will hear from the Global Director of Child Protection and Migration, Shima Sen Gupta, who is also the board of the Primero chair, to give us some opening remarks. So I see you there, Shima. I'm just going to make sure that you can unmute when you're ready. Great. And we'll give it one more minute and then we'll begin. Okay, we are now at 5 into the session. So without further ado, I would like to introduce Shima. Shima, if you can hear and see us, I'm enabling your microphone and camera now. You should be able to now.
Yes, thank you.
There she is.
Good.
Great. Over to you for some opening remarks.
Thank you so much, Robert. And this is fantastic. I'm looking at the numbers and I'm looking at the numbers going up as well. So really, really good to see everybody here. So good morning, good afternoon, and good evening, colleagues, because you've joined from everywhere. So really pleased to have all of you. Welcome to the 2025 Primero Global Meeting. As Robert said, I'm Shima Sen Gupta, and I'm the Global Director of Child Protection and Migration at UNICEF. I'm also the chair of the Primero board, and so I'm really, really pleased to kick off this event with you all. This year marks 11 years since Primero was deployed, and today it stands as one of UNICEF's premier digital platforms, supporting protection-related case management and incident monitoring for child protection, for GBV, and protection programming. It has more than 95 active implementations in 70 countries. Primero is a globally recognized and certified digital public good and a model for sustainability and good digital practice. I myself have a personal attachment to Primero because I actually met Robert for the first time way back, I think 11 years ago, slightly more, when we were even testing it out. And Robert came to Somalia to help the Somalia Child Protection Program set up a CPIMS system, which was new, and so on and so forth. And it gives me great pride and great pleasure to see where Primero has got to now. So really, really very, very pleased to be here with all of you today. As you all know, this year has been a challenging one. These are really times of global uncertainties, instabilities, and also organizational change, not just for UNICEF, but for many organizations out there. So as much as I wish we could all be together this year, for a change, our annual meeting is fully online. But even then, like I said, it's great to see all of you online, to have so many of you here. So as we gather over the next 2 days, I want to remind you all that for this community, adversity is not new. We are adept at dealing with adversity. It's central to what we do. And adversity defines our shared mission to support and to protect vulnerable children and families and survivors of violence. And in the face of adversity, we must come together and we must be resilient. And honestly, we are in November, and when I look back at the year and I look back at ourselves and our partners, I think we have all come together. We've stood together and we've tried to find solutions going forward. And that's exactly what Primero is about. It's about partnership, it's about engagement, and it's about collaboration. So though we can't be physically together for this meeting, I am told we have more than 120 partners from more than 40 countries who've registered to participate in this event. And I'm seeing the number up there showing 100 right now, so I'm sure it's going to go up. And this is amazing, right? It's just great that everybody is being able to join and come to this event. And it really speaks to the size of the community, to the organizations that make up this community. We have government partners, we have civil society, technologists, caseworkers, UN and national as well as international NGO staff. So it's quite a mixed community, because in truth, that's what it takes to respond to child protection needs, to needs of survivors of violence, and that's why we're all here. So this really, really demonstrates the numbers as they're going up. As I'm speaking, I see the numbers going up. It demonstrates a commitment to partnership, to working together, and that's what has driven Primero to new levels of scale and impact, even in these difficult times. When we roll out Primero, we create digital networks of partners who are working together with a common approach. And no single organization can deliver all the services. And we know this, all the services that are needed by vulnerable children and families. It takes a lot to deliver that, and we all need to come together to do so. And Primero helps us deliver better protection together as a team with a common cause. As we've seen this year, when adversity impacts our programs and disrupts our networks, having a common platform like Primero holding things together gives us resilience. It allows us to adapt, to deliver as one, and to reduce the impact of shocks on our programs. In UNICEF, we have prioritized child protection system strengthening as a key approach, investing in networks of child protection actors and leveraging technology to enhance these connections. And technology is a key enabler, helping us to improve program implementation, to streamline operations, and to enhance outreach. But technology is nothing without the people. And Primero is all about bringing people together around that common cause, around a common goal. And it is all about you and how we collectively harness our capacity and our commitment to make a change in the lives of the most vulnerable. So over the next 2 days, we will discuss critical topics central to child protection and to gender-based violence. We'll talk about programmatic priorities, technology vision, risk management, data strategies, and engagement for the coming years. So we'll hear lessons learned, we'll explore new ideas, and plan for scaling up and sustainability. So I really would like to encourage you all to engage actively, to share your expertise, and to help shape our future. Each one of you does things in slightly different ways, in different contexts, and sharing that is really very, very helpful. It enriches what we can do together as a community and where we go from here. A special welcome to our guest speakers, whose insights will enrich our discussions and help us navigate the challenges ahead. As we move forward, let's remember the importance of collaboration and open communication. And together we can achieve our goals, we can make a significant impact on the lives of children and communities that we all serve. So thank you for your unwavering support, and let's have a productive and engaging meeting. Thank you.
Thank you very much, Shima. Great opening for everyone. Happy to have you here. And we're going to move into our, seeing lots of activity on the screen here. I don't even know how to look at 105 people on this screen, but we're going to take our first step into the global meeting. I hope some of you were able to attend the webinar. I am going to share my screen now, and I will hand over to Isaiah to lead us in the first opening session here. Over to you.
Thank you so much, Robert, and welcome again, everyone. So in this session, we are going to have a team of 5 countries presenting. We are going to learn from their countries' experiences on how they have been using the digitalized enabled CPMS, not CPMS, but the enabled digital programming. And we'll be hearing from their key achievements and also some of their programming and lessons learned. We have 5 countries that are going to present, and each country will be having 15 minutes, 10 minutes for presentation, and then 5 minutes for questions and answers. So I'm going to welcome the first country, and we are going to have our first presenter from Palestine, who is Ranchini. Welcome. Welcome so much. Thank you. He'll be talking about the CPMS Plus, and which is being implemented through the CPAOR.
Should I come in?
Kindly, yes, thank you. Welcome.
Thank you so much, colleagues. Very much good to see you. Many of the people that I work with across various contexts and the countries. Thank you so much, Robert, Shima, and everybody also to giving this opportunity to share our learnings and our experience here in Palestine, where we started CPMS Plus very fresh, very quick. Within short time period, we have done a lot of great work. Again, it's with the participation and contribution from all the members of CPAOR. So thank you so much also colleagues who are part of CPAOR on the call for your contribution and collaboration on these initiatives. CPMS Plus in Palestine, we have 2 contexts we are talking about here. One in Gaza, the other one is the West Bank. Both are very completely different contexts and the environment. You see Gaza here in the picture, where there's no safe spaces for children and who are exposed to constant bombardment, grave violation, denial of basic services, no health facilities, limited education facilities, no protection services. And we are talking about 2.1 million overall population, which 1.1 million are children. Looking at children's specific situation and vulnerabilities, 64,000 children has been killed and injured since October 2023. 11,000 of them were like life-threatening injuries, which many of them need long-term care. Next slide. Children who are young as 6 years old involved in child labor in a very hazardous situation and the labor. 1 in 4 families are sending children to exploitation and the labor work, and you would really see number of slides and the pictures coming up. The environment and conditions looks like in Gaza. Risk of violations, including family separation, is raising up. As of now, we have 58,000 plus children who have lost both parents or single parent. Child petition partners have recorded, documented 4,700 plus children who have been identified as unaccompanied or separated children who required continued support, as well as case management, positive parenting, family tracing and reunifications, etc. And 1.1 million children we talk about in Gaza are in need of MHPSS services. That's also came out from the studies. 96% of these children are experiencing nightmares, attack, anxiety, and social withdrawal. GBV and child marriage is also raising in Gaza. You could really see the overcrowded shelters and the conditions where the privacy is a huge concern. There are a huge number of early marriages, and it is children are age of even 10, 11 are married off because of the condition, and it is easier for families to marry off them and for the protection of those children. So that is the kind of conditions across Gaza in many locations. Explosive hazard is another concern and conditions, and you really see that across Gaza, particularly also in the north, in middle part. Many houses are all broken houses, and explosive ordnance are across everywhere. This picture on the corner, see that it is took like 1 week before children were playing with explosive ordnance. So I just came from Gaza last night, and that's the current conditions that even across Gaza, and children, they are not even aware of, even if they're aware of the situation, but they are still playing with explosive ordnance. In West Bank, we have a different context and the situations where children are exposed to militarized operations, settler violence, home demolition, and 600 plus children are in urgent need of child protection services. There's also situation of children in conflict with law. There's a children detention, and some of them are without trial. The closures of school and checkpoints are creating as well more of exposure situation, violence and exploitation. So there's a limited child protection services, particularly in hard to reach areas. Challenges continues for children and child protection, particularly also in Gaza and the West Bank, where there was no harmonized system in place, and everyone, and especially the condition for the caseworkers, they are super overwhelmed. They're all using paperwork or Excel forms for kind of documenting all the cases. There's multiple agencies come forward. They wanted to create a different platform because there are a huge number of unaccompanied separated children, as well as the children without parental care. They want to create the mini platform. So therefore, it was a continuous challenge when we started and putting the CPMS Plus in place. So it's again, it's a very new to all the many colleagues here, and we started in a very quick, rapid speed format. We started the implementation in April, so that was starting with initial discussion and conversation with partners to overcome those challenges. Then we started immediately discussing with our global team. With their support, we started launching the system in May. All the system configuration started as well in May and June. We created the user profile, and at the same time, capacity building is also went ahead, which was mostly online capacity building in June. Then again, we have created the data protection information sharing protocol, as well as the all the SOPs and terms of use all have signed off by partners who are using CPMS Plus. All the primary ground level work has been started. And then we went ahead, go on live in July, and we are in November, that you could really see the progress where we are on the next slide. So we have 23 agencies now you are using the CPMS Plus. 300 plus child protection caseworkers and supervisors has been trained across both UN agencies, INGOs, and national partners. The regular coordination ongoing, and to ensure the standardization, coaching and mentorings are going on to keep up the work and ensuring that all the caseworkers do understand and use the CPMS Plus. Next slide, please. So we had a situation we were not able to do the in-person training. So we did really look at more of online training for these caseworkers. And then that's really, and that's not only that, but also recorded the training and ongoing support, sharing refresher training, and providing coaching and mentoring to have much more flexible support partners to implement CPMS Plus, including one-on-one session on a daily basis, continue to support them. That's more of an adaptive capacity building that we did, not really in person due to the both context in both Gaza and the West Bank. Next slide, please. Currently, we have 1,800 plus cases in the system. Over 5,200 cases has been in the process of migrating into the system. So we will have more or less 7,000 cases between April to November will be in the system in the next 2 days. It covers both Gaza and the West Bank. It's full coverage, and all the partners who are implementing child protection case management are using their CPMS Plus. That continues as well. Challenges continue because the connectivity, you see the infrastructures and structural damages in Gaza. So there's a limited connectivity and function that's really limiting our capacity and caseworkers' capacity. Despite all, partners are still using CPMS Plus. Some paperwork and transition is still ongoing as well. There's a shortage of laptop because Gaza is not allowed to bring any laptops in. So that's the reason we are also helping them with the data migration. So making sure that many cases go into the system. There's a lot of staff turnovers as well. So there's a need for ongoing and continuity of the training and capacity building. So the support continues both offline and online, and using this shared the devices and remote support. So it is actually fast case. Very many caseworkers have provided update and feedback to us, and so they really express how it's useful for them. Also for the supervisors and coordinators, because for example, we have partners who really support us also data migration, for example, because they really understand and they really see the value of the case management and the CPMS Plus. And caseworkers provide feedback. It's saying it's improved the quality of the data, consistency, and also quality of the data. And frontline workers feel supported, and it's also able to really look at the various number of cases and do the trend analysis. And it's improved the stronger coordination and better outcome for children. So that's the overall outcome of the work. Thank you so much. Happy to answer if you have any questions.
Thank you so much for the very touching presentation from the Gaza experience and the West Bank. So I'm going to welcome question in the next less than 5 minutes. So if you have a question, kindly just post your question and then we'll move to the next presenter. So far, I haven't seen any questions in the chat box. The next presenter will be Wosen and Tedros from Ethiopia. They'll be presenting the Ethiopian experience using the CPMS Plus for the national scale-up. So I will welcome Wosen to take us over the next presentation. Thank you.
Thank you, Isaiah. Can you hear me?
Yes, you are loud and clear.
Great. Good morning, good afternoon, and good evening, colleagues. Myself and my colleague from the government, the Ministry of Women and Social Affairs, we are going to present the Ethiopian, the National Child Protection Information Management System progress. So I will start, and then after a few slides, I will hand over to my colleague from the government. So the next slides, please. Thank you so much. So let me start with the context of Ethiopia and how we rolled out and implemented the Child Protection Information Management System. The situation of Ethiopia is very complex. When we start with its geographical coverage, which is a big size country, which has 12 regions and city administration, and the population is like the second populous country in Africa, which is an estimated population of 135 million, and among these 52 of them are children. So this shows like a huge investment on children is required in the context of Ethiopia. The other thing that makes the region, the country complex, is like it hosts a large number of refugees from different countries. It has also, due to conflict, there are so many IDPs and also migrants in different direction, in country and out country migrants. So this situation makes the country's context very complicated. So in line with this, like Ethiopia has launched the CPMS Plus May 2024. It's almost 1 year. So the other thing, besides those issues, Ethiopia has recently conducted the VAX survey. So it shows like huge number of violences. When you see, as you see in the figure, sexual violence is very critical happening in the country. As you can see from the figure, physical violence is also huge, and emotional violence is huge. So this shows like there should be like strong mechanism of service provision is required. So one of the tools that we have been using currently is a digital case management system, CPMS. So since we launched the CPMS Plus, we have been progressing. So we had a good progress. So CPMS Plus expansion or implementation is one of our pledge for the Bogota from the government side. The pledge is like to reach from 2% 20% by 2030, and it was like the pledge was last year, and we have a good progress. And then this year we reached to 6%, and we are currently in the Rise Africa conference tracking of our progress. So CPM is one of the focus area. Besides that, beside the government, UNICEF is advocating together with the Ministry of Women and Social Affairs to bring other CSOs be part of the CPMS Plus rollout. So 10 CSO partners recently assigned MOU with the government to be part of the national CPMS instead of having like a separate one. So they signed the MOU and already started to become the national system. So we signed this MOU in May 2025, and so far, like as you can see here, six CSOs have become part of the CPMS Plus rollout, and it's under the national system, which will be led by the government. So this is good progress. but still we are advocating to bring more CSOs part of the national system. And recently also more CSOs are coming on board and signed MOU. The other progress besides including the CSO is in Ethiopia, we have been using two different systems, Refuge CPMS Plus and the national system. So currently we have been discussing UNICEF, UNHCR, I mean the government, Ministry of Social Affairs and Refugee Return Service. So we are in discussion to bring these two systems in one system, and we agreed on that. And currently we are on concept development and to conduct an assessment how to proceed with that. So these are the progress so far. And in terms of like current statistics, I will hand over to Teddy from the government. He can present. And over to you, Teddy.
Thank you, Wasan. Good morning, good afternoon, and good evening. This is Theodros from the Ministry of Women and Social Affairs. I'm the CPMS Plus System Administrator. Aizia, can you hear me?
Loud and clear.
Thank you. So our system is now operational across the nation. We have more than 500 users providing this critical support in 11 regions of the country and more than 120 districts. And the system is now working in 5 different local languages. When we see the current status, we have successfully registered more than 12,000 cases. From this, we are able to provide a service for 6,000 cases. And we successfully closed 2,400 cases. This indicates us that this clearly shows that active use of in delivering tangible support for them. And now we also integrate CPMS Plus with the Power BI, and now we are getting powerful reporting and analytical capability. This dashboard is a snapshot from the dashboard at the national level. We are now, as you can see, managing more than 10,000 open cases and nearly equal gender splits. We can also track the workflow of each case across each different regions. And as you can see from the statistics, we are able to generate analytical reports depending on different criteria. For instance, from the first chart, you can see the top priority or top protection concerns in the country. And we also, the second one also shows you the caseload distribution across different regions. So this can clearly show that the government is now using this information for targeting and providing resources and support effectively. So from the implementation, it's been more than 1 year, and what we have learned is the first one is strong case management is really very, very important. And the second one is actually practical demonstration. We have to instance the demo and the live, and practical experience on the demo as well as peer learning is really powerful for data quality as well as for enhancing the capacity of the social workers. And the other one is multi-level collaboration between different government organizations as well as different CSOs is also the lesson that we learned. But there are also challenges, as you know, and we face these 3 main problems. The first one is the coordination between the CSO, the government, and service providers across each areas. And the second one is due to the budget cuts, we lost most of our experienced social workers, and now this is creating a capacity gap across different parts of the country. And the last one is the last challenge is actually a bit technical, which is actually we are in Ethiopia, we're using Ethiopian calendar, and now the system is working in Gregorian calendar, and now converting from Ethiopia to Gregorian is a bit challenging for the social workers. That's the big challenge. And as a way forward, as Wasan mentioned, now we are planning to integrate the CPMS with the refugee inclusion. That's our priority. And the other one is establishing multi-sectoral coordination platform at the national level. And then after launching this at the national level, we are planning to expand this across each region and each districts. That's all. Thank you very much.
Thank you so much, Wasan and Tedros, for sharing the Ethiopian experience, both covering the humanitarian context. which also involve the refugee context CPMS and also the government national system with the collaboration with the partners. So I will welcome the questions, and I'm seeing the first question from Subina. You are asking if we can share the readiness assessment form. So I think we'll do a bilateral follow-up on this question, and then if there is another question, kindly, you are free to ask as we bring in the next presenter. So the next presenter will be doing a presentation on GBVMS Plus. This is the data action in multi-country programming, and this will be led by Joget and Rama. Welcome. Rama, kindly confirm if you're there.
I think she's just with David, so we'll just make sure that David can unmute himself.
Okay.
Okay.
Hello. Hello. Can you all hear me?
Yes, we can hear, but there is some background noise that echoes.
Really? David, can we use it? Okay, is it sorted now?
Now it's okay. You can proceed.
Okay. So good afternoon, everybody. My name is Ramatu Kagbo. I'm the GBVMS Plus Interagency Coordinator in Sierra Leone. And I'm happy to present GBVMS Plus Data in Action from Evidence to Impact, representing Nigeria, Somalia, and Sierra Leone. Across the three countries, GBVMS is proving that data isn't just documentation, it's power. It's how we turn evidence into real protection outcomes for women and girls. There's no presentation showing. Where's the Jan?
Kindly, Jan, if you can.
Yeah,
yes, we can see the slides. Yes.
Okay. Okay.
Thank you. Now you can proceed.
Okay, so I should continue. Okay, let me start again. Good afternoon. My name is Ramatu. I'm the interagency coordinator. We're on the second slide, for God's sake. Now, why data matters? In GBV response, every data point represents a survival story. GBVMS Plus helps us listen to those stories systematically, guiding coordination, advocacy, and resource allocation. The next slide, please. Let's start with Somalia, where data is inspiring donor action. The system integrates case management, incidents, and referrals. It helps frontline responders to turn raw case data into actionable insights at coordination tables. The data indicates 27% rise in reported GBV incidents linked to displacement, conflict, and service gaps in southern and central Somalia. Now, when these results were presented to the protection cluster, FCDO requested a technical briefing. The data showed how funding gaps directly reduced survivors' access to services. Compared to the previous years, IPV increased by 37%, rape by 21%, child marriage increased, and FGM rose during emergencies and displacement. From evidence to funding, within weeks, FCDO approved $3 million US. That funding reopened safe spaces, deployed mobile teams, and strengthened case management data, which led to tangible impacts. Still in Somalia, in 2024, GBVMS Plus data in Somalia revealed rising sexual violence and shrinking service coverage. The findings prompted a $1.5 million humanitarian fund allocation in 2025, helping partners restore psychosocial support, strengthen referral pathways, and deliver dignity kits. In 2026, we aim to sustain this model of data-driven advocacy. Now to Nigeria, where GBVMS Plus analysis identified several gaps and underutilized facilities, enabling partners to retarget resources and coordinate more effectively. The data informed joint planning with NGOs and UN partners, improved survivors' access to quality care, and strengthened accountability across the response. When GBVMS Plus data revealed weak support for survivors, UNICEF recruited an access to justice specialist, while UNHCR partnered with the National Bar Association to provide pro bono legal aid. This collaboration expanded survivors' access to justice and strengthened accountability within the GBV response system. This is a change. Now, monthly GBVMS advocacy briefs now reach policymakers across Borno, Adamawa, and Yobe states, translating frontline data into actionable insights. These briefs have strengthened coordination between government and humanitarian partners, influenced state-level decision-making, and ensure that advocacy is grounded in credible, field-driven evidence. Now, reliable GBVMS Plus reporting increased donor confidence and demonstrated real accountability. Evidence from Northeast Nigeria showed measurable impact, prompting support to expand the system to Katsina, Sokoto, and Cross Zamfara. This scale-up is strengthening national coverage, enhancing coordination, and fostering new partnerships across humanitarian actors. GBVMS trend analysis revealed critical skills gap among frontline workers, prompting the development of tailored training modules now embedded within national institutions. As a result, GBV knowledge and ethical data practices are becoming part of the formal education systems, ensuring lasting national capacity and a more professional response. Last but not least, my beautiful country, Sierra Leone, where strong results from the GBVMS Plus pilots convinced partners to expand the system nationwide. The rollout brought more organizations into a unified platform, improved coordination and data sharing among all districts, and enabled governments and partners to plan services and resources more strategically. Now, the e-referral pathways. The next step is the development of an electronic referral system, a secure real-time platform that allows survivors' cases to move quickly and confidentially between service providers. The innovation will strengthen coordination, reduce delays in accessing services. Now, the SOPs. When developing SOPs for one-stop centers, GBVMS Plus data showed that most survivors still report first to the police rather than to specialized services. These findings show the need to raise community awareness that one-stop centers exist and are safe spaces for reporting and care. The process strengthened collaboration between the police, the health, social workers, creating a more survivor-centered response system. In all three countries, GBVMS Plus data is driving real change, shaping national priorities, guiding resources, and improving coordination. The result, stronger advocacy, smarter funding, and services that truly reflect survivors' realities. Now, shared, transparent data has built credibility across the board. Governments, donors, and service providers now speak the same evidence-based language. This transparency has broken down silos, reduced duplication, and proven that coordination grounded in facts, not policies, delivers measurable results. It's a shift from data as numbers to data as accountability, where every figure tells the story of progress and trust. GBVMS Plus is evolving beyond data collection to true system integration. By linking with national protection platform, survivors' cases can move securely and swiftly between services through electronic referrals. This isn't just about technology, it's about trust, accountability, and faster care. As countries adopt new tools, we're seeing stronger connections between data and action, creating a living system that keeps improving how survivors are supported. GBVMS Plus is linking with border protection systems so survivors' cases move safely and quickly through electronic referrals. We're strengthening country exchange, learning directly from each other's experience in rollout, trainings, and advocacy to accelerate regional progress. As you can see on the slide, we came together as a team to prepare this presentation for you today. This is what GBVMS Plus stands for, turning evidence into protection and data into dignity. Every dashboard, every report, every shared data set represents a survivor's voice being heard and acted upon. Together, we're ensuring that data doesn't just inform policy, it restores agency, builds accountability, and reaffirms the humanity at the heart of our work. Thank you. That's about the end.
Thank you so much, Rama, for the multi-country presentation on the GBVMS Plus. Now our next presenter will be coming from Indonesia, and they will be speaking about the Symphone application. So I will welcome Made and Christine.
I think yes. There was a question. There was a question that came up just now. I think I saw a question. Oh, maybe not. Maybe it was somebody that was just reacting and they put their hand up accidentally.
It was a reaction, I think so.
Okay. All right, then I will get the...
The question now just came in. Mohammed is asking, I saw that the highest number of CP concerns is orphans. Based on which criteria orphans are eligible? I think this is for Ethiopia. Maybe if Mohammed, you can clarify. I'm not sure if this is for NEMA or it's for Ethiopia. In our context, the orphan is...
It looks like I think that question is for the Ethiopia team.
Yes,
so
this
maybe,
one is for...
Yeah, Wilson or Teddy can come in and on the chat.
Sure, thank you. So now we'll welcome Cristiano and Made to take us through the next presentation about the Symphone application.
Okay, thank you. Good afternoon and good evening in Indonesia. Thank you for your time. Allow me to explain the Symphony PPA. Symphony PPA version 3 is an online information management system for the protection women and children, development by Ministry of Women's Empowerment and Child Protection of the Republic Indonesia. This latest version aims to improve the quality of service in handling cases of violence against women and children across Indonesia. In an integrated and real-time manner, it reflects our commitment to using technology for better protection outcome. This diagram shows the framework of the program support by UNICEF that strengthen women and child protection service, and where Symphony PPA plays a key role. The program focuses on two main areas. First, strengthening the service ecosystem through institutionalized case management, And second, empowering children and communities through local community-based initiative. Together, this element create an enabling environment where Symphony PPA can function effectively and sustainability. As shown here, the development of Symphony PPA version 3 is a part of a broader program to strengthen the quality of the case management connected with the service ecosystem at all levels. As the Center for Information and Communication Management, its development is always aligned with the change and direction of other relevant programs. Next, our office is a relative young ministry in terms of providing direct service. We began online recording of child violence and gender-based violence case in 2016, a major shift at the time. And then in 2022, we made major adjustment to align with the latest service guidelines. Still, the main function remains the same, mostly to monitor case nationwide. And then Symphony PPA version 3 with Primero CPIMS integrate within service more than just case recording. It facilitates the case management progress and simplify the complexity of supervision and coordination in function code. Also highly strategic to facilitate the strengthening of service profession, which in turn strengthen the overall protection system for women and children nationwide. Developing Symphony PPA version 3 with Primero Insight has become increasingly important of national policy. The first driver is requirement to build in an information management platform that support Indonesian One Data initiative, a national policy that ensures data across all sectors are consistent, connected, and used for better decision making. Through this, Symphony PPA version 3 contribute directly to strengthening evidence-based policy and coordinate action to protect its service. The second driver is a need to create a system that goes beyond practically day-to-day case management. We're building a platform that also support the establish of a national integrated protection service system, where every case, every service provider, and every level of government can connect through set standards and reliable data. This will help ensure for the women and children receive consistent and effective service where they're in Indonesia. That information management system must be built on a fully compliant with global principle and professional standard for case management. It must also guarantee strict adherence to data protection and ethical information sharing. This is where we see the true strengths of Primero as a platform. It is designed to meet this global standard while remaining adaptable to our national context and service realities. So once again, developing Symphony PPA version 3 with Primero Insight is crucial for us. It's not just a technical upgrade, it's a strategic step that align directly with Indonesian One Data policy. Through this development, we are building a more connected protection system. In short, a Symphony PPA version 3 position us to manage data better, collaborate smarter, and protect women, children more effectively. The contextualization and configuration of Primero CPIMS allow us to record every stage of service in case of child violence and GBV, from first contact to case closure. However, our development began soon after new national standard for service delivery were issued. This means we had to ensuring every technical feature alignment with the newly established operational protocol at time, but also ensure the system long-term reliability and quality. We also engineering the system to work in hand with other digital tools. This include a hotline application that receives report directly from survivor or concerned individuals, and a ticketing system that tracks complaint handling and allow beneficiary to monitor progress. Together, this feature makes Symphony PPA not just a database, but a responsive platform that strengthens accountability and transparency in service delivery. Okay, next, another key objective of Symphony PPA version 3 is to bring to local managers and up to national decision makers. Everyone can now access and use the same reliable data. This creates a common language for coordination and policy planning, enabling protection effort to be more targeted and effective. Next, this means managing real-time service information from more than 554 user group across 514 districts and cities, 38 provinces, and national level. With Indonesian decentralized governance system, this was not easy task. It required long process of dialogue, consensus building, and system adjustment, but the journey also strengthened collaboration among institutions, which will make implementation more sustainable into long run. Next, the slide illustrates the overall process of developing and integrate the Symphony PPA version 3 system. In this progress, the contextualization of Primero CPIMS has been expanded to exclude the gender-based violence component because we need one unified platform for managing all cases involving women and children. We are in the final stage of developing an integrated dashboard. This dashboard will allow managers and policymakers to monitor trends, track performance, and make evidence-based decisions in real time. Next, for your information, we use the Tier 1 approach, relying mainly on the ministry internal resource with technical and strategic support from our colleague and UNICEF Indonesia. After a long and careful journey of development, we completed the application phase in October this year. This marked the beginning of a new phase as we prepare for full and national implementation starting in January 2025. Our focus are not shift from development to ensuring quality rollout and user readiness nationwide. Next, at present, we conducting implementation testing in 18 provinces and 32 districts or cities before the full nationwide rollout. This is a major transition for many user groups who are adjusting to new tools and new ways of working. To support them, we have opened multiple learning channels from tutorial video, online, for continuous technical assistance and on-demand coaching. Okay, for next explain result, what success look for? It's a fully digital interoperable case management platform across province and district or cities, consistent and reliable data informing national child protection policies, including funding allocation, improved service response and accountability for survivor, an element with Indonesian One Data protection vision. Next, this is toward One Data, integrate data on VSC and GBV. In 2026, okay, in 2026, we have a regulation and a roadmap. Another is interoperability from our framework. For next years is in 2020 and 27. We have a data framework and standardization and system development, and so we have testing for 38 provinces. For 2028, integration platform of GBV and VSC integrate data. So interoperable integration data system implemented. Next. This is a Symphony PPA version 3 with Primero. When Symphony PPA version 3 and Primero marks a significant milestone in Indonesian journey toward integrated when a data-driven protection service ensuring no child or no woman is left unprotected. Next, thank you for this our presentation. If any can be thank you. Good night.
Thank you so much, Cristiano, for your enriching presentation and showing us how you're also collaborating with other service providers like the GBIMS, the interoperability between the system and also the wider scale up of the system. I'm seeing it's covering 514 districts. So if there is questions for Indonesia, kindly keep posting the questions, just checking from the chat box. But this, I'm seeing this a message to Ranchini for the good work that you have done before in Iraq, Ukraine, Bangladesh, and now also in Palestine. So this, you are just being appreciated for the good work that you have done before. And we are hoping to continue seeing the good results from your side. So if there is no more questions or maybe comments to Indonesia team, then I'll move to the next team, which is from Pakistan. And we'll be hearing from the CPMS in 4 provinces, which will be presented by Shakel. Shakel, welcome.
Hi, thank you so much, Isaiah, and thank you so much, Robert and Janani, for giving us this opportunity. First of all, can you hear me well? Okay.
Yes, it's loud and clear. Proceed.
Okay, thank you. So I'm going to present today. It's a journey of Pakistan. The way we started from 1 pilot to 5 complete deployments. And I'm going to present on behalf of all my team members, my child protection team in Pakistan, our government counterparts, our technical experts. So this is, let's be with us in this journey. Next slide, please. In a glance, you know about Pakistan, so you can see it's the 5th largest populous country, and we have around 112 million children. This is nearly half of the population, and Pakistan is also prone to natural disasters. We are one of the top countries who are vulnerable to the climate change risk as well. So this is the children who are at risk. So there was a need to have a unified case management system. And that's how we started this journey nearly 8 years back. Next, this is a very quick overview of our journey. We started with the assessments in all our provinces. We did assessment of the system they were using. There was a paper-based system. Some were using Excel forms. And these starting 2-3 years helped us reach to a point where in 2021 we have our first deployment in Balochistan, and then around 2022 and 2023 we managed to expand it to 3 more provinces, 2 provinces, 1 territory, and our recent deployment is in Punjab. And today we have 4 complete deployments and 1 territory where we have rolled out Primero. We are using tier 1 deployment, and why we are using it, it's because one of the need was that the data has to be within the country. And besides that, as per Pakistan's constitutional decentralization, we need to have separate data, placed in all provinces. So provinces have their own ownership. They wanted to have their own customization of the data. They wanted to have flexibility to modify and change. So this is one of the reasons we started with the tier 1 back in 2018, and we are still continuing with the same. Very quickly about the legacy challenges, although it took us a lot of time to overcome those challenges. But what were those challenges? When we started, we were using the older version of Primero, that was Primero 2.1.0. and we did some alteration in the codes that caused problem for us. We were not getting Primero updates. Besides that, we were facing dashboard challenges. We tried to make our own custom dashboard, which were fine, which were good for our needs, but that code alteration was causing issues for Primero updates, and we were not actually the part of the proper Primero latest systems. And besides that, our government counterparts and we were also learning. We didn't have that much technical capacity, our IT teams. So these were the initial challenges we were facing when we started to work in the first few years. Another very crucial challenge which we faced was that request from the government to have the data migrated from Excel to the system. They wanted to have the legacy data entered, and that data was very fragmented in spreadsheets, some in offline forms, some in totally different formats, some they need to do the data entry as well. So we provided them a solution. We really worked hard on that. We made scripts for that. We made validation pipelines using FRAPI, which I'm going to cover in one of the latest slides. And the result was that we managed to have the historical record successfully imported in the system. And this is how government actually wanted their dashboard to be. They wanted to see their historic record, their trends as well. How we are managing our data right now, we are using local data centers supported by UNICEF and the government counterparts. We are doing the regular backups. We have no cloud dependency at the moment here for these 5 separate hostings. And we believe so far this is a very sustainable model. Government is satisfied that their data is secured with them, and it's very much accessible to them whenever they need any report, anything. The dashboards are very much accessible to them. And so this is how we are working on our servers. Next, please. The way we are managing the changes it took us some time. This is also part of our journey that we learned with time that we need to come up with the proper SOPs for that. So we developed those SOPs, how we are going to incorporate any changes. We need to work on the revisions of the forms. We work on the form in a way that we test them fast before they go live. Government and UNICEF jointly reviews the forms. And recently, what we are trying to do is that we are trying to have similar forms and align them with each other as much as possible. Initially, as I mentioned, that the context, majority of the forms are same, but some context in different provinces was different, so our forms were slightly different. But now we are going towards a direction where our forms are going to be quite similar to each other. Next, please. System management and governance. So version control, now that we have properly shifted to the latest code base of the Primero, we are now each time when there is new version, we see the changes, we ensure that we roll out that version. We have a proper pilot environment with here with us. So we first try to pilot the changes before we roll it out, and with proper instructions, with proper emails to the partners, our government counterparts, we roll out those changes. And working very closely with the Primero Global team, Robert and Janani, special thanks to them. And this is really helping us ensure that our system remains current, secure, and it's aligned with the global best practices, what we need. Thanks. Next. As I mentioned, we have 5 separate deployments currently working, currently operational. So we have local ownership. These are fully owned by the local government counterparts in our each province and territory. We only provide them technical support, but the day-to-day operation, we have managed to reach to a point where we have built their capacity, and they are managing their systems now. Whenever they need any support, we are there. And whenever they need any national level, we need to guide them about different protocols, SOP. This is something we help them. We help them conduct the initial trainings as well, and we have reached to a point where they themselves are now trying to replicate the trainings as well. The more district they are going to roll out. Next, please. So I touched upon Frappy. Frappy we covered in one of the data challenges last year. So maybe that can be accessed. What is Frappy? Frappy is the open source tool we have or platform we have used to build our dashboards. So it's real time. We are using Primero's APIs. Other than that, we are doing some smart extensions in Primero as well. We have adopted SMS notification using the local SMS package through the operators as well. We are using open source. All these enhancements are open source, and they are actually we are using the same authentication of Primero. So they are built in these instances of Primero we are running without even changing the Primero code, and this is not affecting our global updates. So these I can say that these are the innovations through which we are trying to enhance the functionality of Primero without affecting the code base. Next. Why we selected Frappy? So Frappy, one of the reasons we selected Frappy was that it's open source. We government and other counterpart don't have to pay any fee for that. It supports SQL, it supports Python, it's real-time live dashboards are there. It's also support the alert system. It's secure. The data ownership is with the team themselves, and it's so user friendly that they can customize and design their own graphs and charts as well. And unlike Power BI, it's fully owned by government teams. So for a long-term sustainability, this is really helpful for them. So here you can see few of the dashboard screenshots, and for each province, it's not that we are doing the replica of each dashboard from one province to other. So we sit together with them as per their needs. We customize the dashboard. So the Balochistan dashboard may slightly look different than the KP, and this is on the needs of government. We are always aligning the dashboard, and new reports and graphs are always added. You can see the logos of these 5 provinces and 1 territory, which is Punjab, Balochistan, KP, Sindh, which are currently using it. And when I'm saying that they are using it, they are still not fully using it. So in some districts it's rolled out. So it's a gradual process. They are taking it forward to the remaining district time by time. Nearly 300 active users with government and partner organizations are there, and we have over 40,000 cases already added in these 5 deployments. I'm also going to share an example from our system integration, the way we have successfully worked in our KP province with our excellent KP team. We have aligned and integrated our Primero with our chief minister's dashboard. So they wanted to see the progress at the higher level in the province. So using the Primero's API, we have managed to have that established this link. Besides that, in KP, we are also linking it with the police MIS, the social welfare MIS, and health MIS. So these are so this is the innovation we have done in KP, and now we will be moving towards the other provinces in similar pattern. Expansion roadmap. So as I already mentioned, the gradual district-wise expansion by the government. So while UNICEF has already provided them technical support, we always encourage government to expand it to the other districts. So this will continue. We are going to work more on this family tracing and reunification module, which has been launched last year, but we believe that there is still a lot of room to work further on this part. We need to further strengthen our referral pathways, because these partners, it's not that easy to have them on board because of different, challenges. But this is one of the area where we would like to further work further. And then another area where we would like to integrate our dashboards into one national board that I will share later how we're going to do it. Next, please. Very briefly, in this one slide, you can see how we reached from one pilot in 8 years. That started as a pilot, and we have now transformed in 8 years into 5 deployments, hundreds of users. We can easily say that it's a lifeline of protection. Primero is now actually a crucial system for all the provincial governments, and they are all national
Sorry, you are breaking up.
dashboard.
Sorry, I don't know if I'm the only one who can't hear or it's.
Can you hear me?
You are breaking up. We can't.
Yeah, I can't hear either, Isaiah.
We can't completely hear you, so
Okay,
maybe
you,
for the last 3 slides, we were not able to hear you.
Previous slide, I was unable to discuss that. Janani, can we go to the previous slide? The one before that? Yeah,
Yes,
so this is our expansion plan and something planning. Yeah, so this is something we really wanted to want to go in 2026, that we would like to have a national dashboard under the umbrella of our National Commission on the Rights of the Child, who has this mandate to get the data of all the provinces, and we need to have that data readily available for like high level decision making, checking the trends at the national level. And UNICEF is committed to support government or to work on this. This will be our commitment in 2026. Next slide, please. And then I would like to mention again that what are the champions behind it. So every child in Primero, represents a real story, and a lot of hard work from all the social workers, the government parts in Pakistan, the trainers from UNICEF team, the local teams in each province and country office, and especially the policymakers. So our goal is simple. We want to have this one mission, one platform of Primero for the case management and for the children of Pakistan. Next, please. And thank you so much. And if you have any question, I know it was not easy to cover the journey of 8 years in this a short time, but if you have any technical query regarding or any other aspect, I'm more happy for any bilateral call discussion with any country office, any team member. Thank you from all of us from Pakistan. Thank you.
Thank you. Thank you so much, Shakel, for your presentation from Pakistan. I think this is one of the few Tier 1 instances that I have heard of. I think now this is the third one, and we are seeing the great job that you are doing in terms of the in-country data hosting being managed by the government and with the support from UNICEF. We also talked about the ownership, and it's good to see that the government is owning the system and supporting the system independently. We also had a good experience. We have learned from you are transitioning from the legacy system to where you are, and the progressive work that you have done to see this big achievement that we are seeing from there. So maybe just going to the questions from the chat box, I can see there's a general comment from Mohammed. So that's a general comment for all the presenters. And then Teddy had responded also to Mohammed. Then Here there is now one question for all the presenters from Pedro. Pedro is asking, he has a general question to, in the situation where you receive information about situations that require case management for CP and GBV via the community feedback mechanism stroke public facing channel, how do you transfer this sensitive data to CPMS or GBVMS system? So I think people who have answers, you can just respond to him bilateral and keep on posting your questions. I'm also seeing another question from Lillian. In Somalia, we still have the feedback as part of the case management process. So for the cases that are managed, we are able to close the feedback loop. Your question, however, is for a larger group of people, community. Oh, so he was just responding to the first question. Thank you so much. And then we also have another comment from Mede. The question is going to Indonesia. Oh, he's saying he's in Indonesia. Case management and CPGBV is managed through the government under the Ministry of Women and Empowerment and Child Protection. Thank you so much for your comment. And then there's another comment from Mohammed, giving thanks to the Pakistan team. If you could please explain mainly quality issues with the CPMS, maybe you can have the bilateral touch base just to share more about this. And then we are seeing more comments and people appreciating the good implementation. Thank you so much, all the presenters, and those who have questions, keep your questions coming in or comments, and then we can just catch up on the bilateral catch up just to respond to your questions. So maybe just to sum it up before I welcome Robert to pick up from there. When I started, I didn't introduce myself. I'm Isaiah Osoti from East and South African region of Africa. So I'm the CPMS and the Primero focal point from this side. Thank you so much and welcome Robert to take over from there.
Thank you, Isaiah, for bringing us through that session. And I know everybody put a lot of effort into this. We want to give everybody in the community a great a variety of different programs that are digitally supported that are using Primero. We saw Ranjini's presentation, amazing work that she's doing with the AOR and partners in Palestine and in Gaza and these places that are just real humanitarian crises. Then we saw national scale up in Ethiopia, which was in the plans for a long time, very complex, now national ownership and coverage. We saw this multi-country GBV-IMS data and evidence that are forming policy and all this great partnership. After that, we saw this amazing adaptation of Primero in Indonesia with potentially the greatest scope of any planned implementation that we have. And our relationship goes back with the ministry there many years, the symphony presentation, fascinating stuff. And finally, Shaquille's presentation on the great work in Pakistan. I love to talk about this. I talk about it all over the world when I'm engaging with governments as a demonstration of how governments can lead their own implementations. So all of these were great presentations and very, very difficult to do this in a virtual setting, but I do think we want to vote. It'll be fun, and it's just for a nice little prize. So what I'm going to do is, Jan, share the link with you there. I'll ask everybody just to navigate to this very simple form. You just have to pick one, yeah. And after a couple of minutes, we'll go and we'll check the leaderboard and we'll see who's winning for this. There was a comment there by Noor, I think, about what's the purpose of this. We're just having fun. We're just having fun. We're encouraging our partners to share their experiences, to share their learning. You know, at the end of this, we'll have a little prize, but this is really just a way to keep it interactive, keep you engaged. So please do fill out the form. And in the next couple of minutes, what we'll be doing is we'll transition to the next section of the meeting. So I do want to just quickly look at the agenda so everybody can see the agendas here in the global meeting link. So we are just a few minutes behind schedule, but frankly, we're doing pretty good. And we are scheduled after the next session to have a 15-minute break. So we will ask you to stay with us for that little bit of extra time there. The other thing that I wanted to do was in a normal meeting, in one of our normal in-person meetings, we would be collecting inputs from all of you throughout the meeting. And that information is really important for us in the core Primero team for making decisions about where we're going to work and the demand for the coming year and the types of software and implementation support that is going to be needed. So in order to do that this year, Jan has very kindly set up this whiteboard for us. And the idea is, as you're listening to your colleagues talk about different things, I want you to be thinking about how this is relevant for you. Now, that can be different things. It could be something that you're learning. It could be something that you're missing out on, or that you think that you need that you don't have. It could be something that you want us to prioritize in the next year, or any other idea. So what I'm going to do is, this is in the webinar, or sorry, in the agenda. So you already have it, and this is for anybody who is on the meeting. So what we want to do is just make sure that you have a place to record your ideas and your suggestions for us. So we'll come back and look at the whiteboard later, but for now, what I'd like to do is we'll check in on our voting, and then we'll hand over to Elise, who's going to lead us on the next session of the meeting, which is on Primero data and evidence. So with that, I'm going to stop sharing my screen briefly. I hope everybody was able to follow that. I'm going to paste in here this, that is the presentation deck that we just had from the last presentation. And Ali, if you're getting ready there, I'll ask you to bring up the next slide while I look and see how our voting is going.
So, yeah, thank you, Robert. Can you hear me? Just double check.
Yeah, hear you loud and clear.
Okay, so let me first share my screen. And then here we go. So can you all see my screen? Can you see it, Robert?
Yeah.
The presentation, good. So good morning, good afternoon, or good evening to everyone joining us today, and welcome to the Primero Data for Evidence and Impact session. So where we'll be featuring the 2025 Primero Data Challenge contestants. My name is Ali Al-Babad, Primero focal point in Europe and Central Asia, and I will be facilitating this session. Where we get to see how Primero data is being used in real contexts to drive change and shape programming. So, let's start with the objectives of this session. So, hearing from change makers using Primero data to make a difference, identifying new data usage strategies for your context to fit your purpose, and we will wrap up by voting for the best Primero Data Challenge submission for this year. So the Primero Data Challenge, for colleagues that are new to it, is an initiative of the Primero Global team in response to the demand from the community. It advances the data-driven programming in the protection and social welfare sectors while supporting safe and efficient service delivery. It is basically a webinar series focused on themes related to data usage, and we have had it going amazingly for the past 3 years, or for 3 years in a row, where with 2 to 4 webinars per year, where teams shared their Primero data work with the community to help learn and build the capacity of Primero users and administrators to make the most of their data. And same as every year, there is always a prize for the best contributors. We'll make sure that the link is in the microsite by the end of the session. The link, to the microsite of the Primero Data Challenge first, and then we will share with you the voting link as well. So this session will be featuring 4 15-minute short presentations from our 2025 Data Challenge contestants, each showcasing the innovative ways data from Primero has been used for evidence and impact. So we will have a presentation by Suman and Gisela on the child functioning module rollout into Timor-Leste, then climate markers in East Asia Pacific by Mohan and Stephanie, Ghana swims insights presented by Young, and a demo on the Primero Global Dashboard by Jan. So just to check, Suman and Gisela, are you with us? Are you able to unmute yourself?
Yes. It will just be me, Ali. Gisela cannot join, but yeah.
Yeah, sure. So I will be controlling the presentation. Just hint me when you want to go to the next slide.
Thank you.
So the floor is yours.
Thank you, Ali. So just to start, I do want to just acknowledge and thank Headquarter Primero team, and I know Lucy, I don't know if Lucy is here, but Lucy, who did a lot of work on the child functioning module. So actually we're very lucky that we got almost served on a plate, very nice plate, and a very almost ready-made tool that we had to give very little input into, but we're implementing it. So I'll be talking on child functioning module. I'm Suman, as we said, I'm Chief of Child Protection for UNICEF Timor-Leste, and this is something we've done this year. Thank you. Next slide, please. So we started this year with, again, as I said, we already were given the subform, and some of the contextualization had already been done. So we kind of get inputs from our context, but also what case management would work in. That was followed by internal training to us, actually by Lucy. That was then followed obviously to training to government users. And actually the time frame that was a bit of a lag was primarily because on our end that we couldn't actually meet the government workers very soon. And then quite soon after, then we've gone live, the system. So we are actually very fresh, just recently started. So we do not have a lot of data, but we do have experience that we can share. Thank you. Next slide, please. Thank you. So what is this that we're talking about today? So it's basically a subform that is actually integrated and embedded in Primero, which is on potential difficulties across various domains on functioning of 2 groups of children, obviously, 2 to 4 and to 17. It follows UNICEF Washington Group on Disability Statistics, Child Functioning Module Guidance. So it's not a new, but what it is, it's contextualized to how it easily fits into Primero, so allowing us to really use it, standardized information. So that is what it does. 2 primary purpose is, one, obviously to understand the potential difficulties of child, and so that it improves our case planning and services. The second is actually to help plan and data. So monitoring, reporting, analysis, and that's a very key component. And I think probably where using the CFM module that is influenced by the Washington Group actually is useful, because it is used but in a standard way. So it gives us a very comparable data across. Next slide, please. So just so what it is and what it is not. So and this was something also was very, obviously strongly felt in our team also, like, it was very clear that obviously this is not my medical diagnosis. And I think this is important information for us because it's not something that you can take to court. It's not something you can like go to a social protection ministry and say, okay, we have cash transfer based on this. So, and it is not necessarily disability assessment and medical assessment. So this is what it does not do. What it does do is still allows a caseworker to actually understand the difficulties in functioning of a child and how to best support them. So in a sense, you're really implementing the better casework from this method. And the other thing what it does is data monitoring and reporting, as I said. So it's, it serves the purpose of not only donors, as we say here, but actually really understanding the prevalence in our population. So in our group, whichever our population group is, and then to really help with the policy and analysis of what's going on, like, who's being served, what services they need. So it's really helping to help with the policy and planning and decision making. Thank you. Next slide, please. So why did we do it? So Primero was launched in Timor-Leste last year, 24 March. And it was really well received. So it was like the caseworkers really like it. They think it has really changed the way they work. So what they want to do is continue to enrich it and strengthen it. So it just becomes and, provides more holistic support. So actually, when we launched it, we didn't put any information on disability there because we wanted to use this module because we knew it came with like, standardized, like globalities that could be contextualized. It gave us comparable data and it gave us like kind of already a robust way of collecting it. So we didn't want to like try, various other methods in country. So we actually waited for this module. When Robert and the team gave us this opportunity, so we really jumped at it and said, yeah, we're going to happy to do it. So it gives that it obviously is part of our own accountability. The government is very keen on, serving and disability inclusive. So it was very important for that. As we move forward, we will be making sure how we then compare. I know you will hear from another two colleagues later on the climate marker, which is also being piloted in Timor-Leste. So we're very keen on seeing, okay, what is the correlation? Is there something we can learn from this data, CFM, as well as climate marker, who was affected? And obviously, we're also going into alternative care, residential care, doing the children's assessment and registration. And we'll also be seeing, okay, what was the prevalence there and what does it show us? So for us, it was important both from accountability perspective, but also so that we didn't want to really duplicate it. There was this like really great tool that was available that we could use. And that is the reason we actually use this particular CFM module. Next slide, please. So at the moment, as I said, just because we have only just really gone live, we do not have a lot of data to share. But what we are hearing from the caseworkers is that they're finding it like effective and useful to really have a better case management. So far, we've only got about 12 cases, as we say, only like last 2 weeks. And it looks like just from these cases, it looks like some of the visible functioning difficulties was obviously easier to identify. And sometimes what the caregivers are struggling or don't know how to assess is like more the behavioral and anxiety, that aspects. So that is kind of coming in this particular data set. And actually that is, so I don't know if it's the psychosocial aspects, or is it the caregivers maybe not aware of it, or we haven't quite used to how to assess it. So that's what we're seeing so far, and we'll learn more about it. So our idea is that we will be doing this for all the cases that are coming into the contact of the child protection system. And again, I say whether they're visible or not visible, because I think that is the main crux here. And we'll be doing this progressively for all cases in the system to understand the prevalence and how we provide better services. Next slide, please. So what are we hearing from the caseworkers? Is it is easy to follow and to administer it. So I know if you're feeling like, oh my God, it's just so many questions, it's long, it's complicated, so many forms, it's actually relatively easy to follow. And we actually only had, I think, about half a day training to the caseworkers. And obviously we are giving mentoring support afterwards and having like quarterly reflection meeting, but they could adopt it quite quickly. So it was not a difficult process to actually launch. It's well structured in Primero, that's what we have found, and it answers activate next questions. I know Robert has talked about skip logic, and I think we share how it actually, the demo version in the chat. It helps us to, and parents to think and reflect for a moment of a child functioning at the age of the child. So, you know, that is helping caseworkers to think, and it's actually helping caregivers and parents to think, you know, what's actually happening with the child and child well-being. Two challenges that have been shared with us is one is obviously the language. So, I mean, for Timor-Leste, like we do have a national language, which is a Teton, but there are a lot of local dialects. So, so that is a little bit, we're struggling to, not struggling, but we need to have more dialects and understand different functioning modalities, some of the new terms in local dialects. And obviously there are like a lot of examples or questions that you have to talk about distance, how long, like how far the child can walk and stuff. And I think there was an example that was shared, like, can your child walk like 100 meters, for example, and they didn't know how far 100 meters was. So then it was like, okay, it's as big as a football field, but they're like, there is no football field in the local area, so they're playing in the riverbed. So it's just like interesting kind of like understanding of the situation, local situation. So it requires caseworkers to work more and find more ways of interpretation. Thank you. And this is the last slide that we wanted to leave with you, which is basically from a casework. Like before we had this, we're only really collecting further information when there was some visible disability. But now with this, we're actually doing this proactively with all the cases coming in. And it's actually what is showing is actually it is those that were not visible firsthand so far that's actually being recorded, and they are being able to talk about it for better services and case management and then discussion with the parents, which is actually really interesting and something, you know, that has come quite like immediately, even with small caseload. And that it has made the casework analysis and planning more comprehensive. And yeah, and this is, I think, my last slide, but just to say we are very excited that we have this. The government and us, and I think again we really struggled with the data on disability, and for the last year we couldn't provide anything, and it's kind of a big accountability for us. So we're very keen to get more data on this, but also obviously better services for children. That's it from me. Thank you.
Thank you very much, Suman. And I've personally heard a lot of good things about the child functioning module, and it's interesting to me personally how Primero, especially this year, ended up taking different shapes and forms, not just a child protection case management platform, but also serving different purposes. Thank you very much. Since we've wrapped up this presentation before, like less than 15 minutes, so I think we can open the floor for 2-3 minutes for questions. Anyone has a question, please raise your hand, put it in the chat, or use the question and answers box. So I think we're seeing one hand up here. Let me unmute, allow mic. So yeah, Khulud, please, can you unmute yourself?
Yes, thank you very much for this useful presentation. It's really helpful. Just wanted to ask whether the base for this module, the child functioning module, you based it on the Washington group questions only, or did you include any other types of assessment tools?
So it was based on the Washington group question, the same CFM module, because so we didn't add anything necessarily in that particular module. Obviously, we have Primero, which already has other features, our normal case management process and other assessment modules, and they're already there. So this was a new subform that we added.
Okay, the reason why I'm asking, because we in UNRWA were interested in this, but we felt Washington Group, yes, they are good, but again, they are good only for very like general screening, but not for a really deep assessment of types of disabilities, and sometimes they might be also very subjective.
Correct. So just on that also, maybe I will also like re-emphasize that. So it was made very clear to us that it was not a diagnostic tool, and that if there was a further need, the children would be referred for a more assessment and medical assessment. So I think from that perspective, actually, it worked in our benefit, because child protection officers are sometimes wary, and because there is a law on child protection, law here. So depending on what the assessment says, they said, oh, it may not be taken by the court, it may be taken by the court. So what we're very clear was, this is not a medical assessment, and this was not that kind of diagnostics, but it was helping for better case planning, and it was going to give some prevalence about, what is most difficult, cannot do, or more like most difficult. So, but agree. But I think you can still use it and then refer to more specialized assessment, which I think works better in our case, because not all child protection officers can do actually the assessment diagnostic, which therefore I think it works better for our more like parasocial workers or social workers type of response, was our experience.
Thank you.
Thank you very much. And any other questions, or we move to the next presentation? Thank you very much again, Suman, and we'll move along with the second presentation of this session. So Mohan, Stephanie, any of you with us now?
Yes, we both are here.
Yeah. So yeah, please go ahead. The floor is yours.
Great. Do you hear me? Yes. I would begin.
Yes,
yes,
we can.
Okay, great. Yeah. So greetings, everyone, and many thanks for the opportunity to join the conversation today. So my name is Stephanie. I will provide some background which led to the Climate Marker Initiative in East Asia and Pacific region, and Mohan will join and offer some key technical insights. Next slide, please. So East Asia and Pacific region is one of the most disaster-prone in the world. And we know that the intensity and the frequency of extreme weather events is projected to increase across the region. UNICEF issued a report, which you could see here on the left-hand side, over the tipping point. And this report really demonstrates how children in our region are confronted with unparalleled threats to their safety and their well-being. So just as an example, children today in East Asia and Pacific, compared to their grandparents 50 years ago, experience a 6-time increase in climate-related disasters. And then we also know that climate change is a threat multiplier for child protection. So UNICEF, the regional office of UNICEF in East Asia and Pacific region, issued an advocacy brief, which you can see on the right-hand side, which really makes the case that the climate crisis is a protection crisis. So we know that climate shocks exacerbate vulnerabilities, that they undermine or disrupt community systems and services. We also know that they increase socioeconomic stressors on family, and compounded, all of this increases the risk for children to be exposed to or to directly experience violence, abuse, exploitation, and harmful practices. And we also know that climate change impacts induce new protection concerns, for example, climate anxiety, as well as the range of child protection risks that are associated with displacement and migration. Next slide, please. So what do we need? This is the question that we have been grappling with and that we have been working on for the last 2 years, together with child protection colleagues across the region. Basically, we need climate resilient child protection systems, services, and workforce that are able to anticipate and to deliver shock responsive and inclusive protection services to children that are impacted by climate change wherever they are. And while we know that child protection services are absolutely essential to prepare for, to respond, and to recover from climate stresses, shocks, and disaster, we also know that all too often the role of child protection services is either not understood or not prioritized, and is usually overlooked in the climate space. So it is imperative for us to position the child protection sector and the child protection priorities within climate policies, planning, and financing. And in order to do that, we need to have compelling evidence. So we need to generate evidence on the dynamics between climate change impacts and child protection risks and harms. Next slide, please. So how can child protection system become climate resilient? Well, there's a series of climate adaptations that are required. And as of this year, for our region, we have 2 landmark resources that can really help us to select, to prioritize, and to implement climate adaptations at country level. So you will see the first one on the top is the UNICEF Regional Framework for Climate Resilient Child Protection Systems. And this framework identifies over 50 climate adaptations across the 7 domains that make up child protection systems. And then the second landmark resource is the ASEAN Regional Guidance on the role of social workers and the wider social service workforce in disaster risk reduction and climate resilience. And you can see through the red arrows here that both resources specifically recommend to integrate climate markers in case management and in information management systems. In order to do what? In order to track hotspots and in order to track cases where climate change is driving vulnerability, protection risks, and harms. So across these many adaptations, there is really a loud and a clear call to leverage Primero and to adapt case management systems. Next slide, please. So the spotlight is again on Timor-Leste. So Timor-Leste was the first country to take up the call on the climate marker. So from the onset, Timor-Leste applied a collaborative process, which began with a co-creation workshop, which gathered disaster, climate, social welfare, and caseworkers. And so the Timor-Leste case management process was really scrutinized and reviewed through a participatory approach with a climate lens. And all participants that you see here on the picture really agreed on where and how to insert climate markers into their Primero system. Next slide, please. And so while the lessons from Timor-Leste are really still unfolding, we wanted to highlight here that the process in itself is of value. So this is to say that it cannot be reduced to just inserting a few boxes to be ticked off in Primero. So the process that was adopted, this collaborative process that was adopted from the onset in Timor-Leste and is still unfolding, really allowed to overcome traditional and siloed approaches and to secure the buy-in into this climate marker across different sectors. It was also an opportunity, this training, this workshop that we did, to really sensitize actors and for them to really reach and align, to reach a common understanding of what climate change impacts are and how they impact child protection. And then finally, and importantly, and this echoes some of the presentations made before, it really allows to elevate the work and the unique position and the unique contribution that social workers are doing to build climate resilience. Next slide, please. This is where I pass it back to Mohan.
Thanks, Stephanie. And Ali, can you confirm if I'm audible?
I can
Do
hear
you
you. Yeah, I
You
can hear
cannot? All right.
I can.
Thanks.
Yeah.
Okay. Thank you. So, as Stephanie mentioned in earlier slides, so we require series of adaptation for child protection system to be climate resilient, and the climate marker in Primero is one of those adaptations. And for the adaptation of case management and information management system for a climate resilient child protection system, we see it as a three-part process. So first, we identify and document the cases where climate events drive vulnerability and harm. And then we generate the quantitative reports and qualitative insights on those linkages and use those evidence for advocacy, policy planning, and resource allocation. Next slide, please. Yeah, so with regards to how the integration actually works. So in our initiation with in Timor-Leste, so first we started by capturing the climate context. So in the case management system. So it includes both capturing the rapid onset events like cyclone floods, but also the slow onset events like drought and sea level rise. And in second stage, then we went and identified in which exact case management stages and forms should the climate marker be integrated. And one of the lessons from Timor-Leste workshop is that the climate marker could be integrated in more than one case management steps and forms. So in Timor-Leste, so it is integrated in registration for an initial flag and then assessment stage for full details. So the way we have configured the system is that the initial marker, the climate marker in registration stage, carry through automatically in the assessment stage, so they can be updated as caseworker get more information during the comprehensive assessment. And then finally, with those data collected, we can get reports and analysis to identify the hotspots and the patterns, but also the dynamics between climate impact and child protection risk and harms. Next slide, please. So in terms of the evidence generation from this climate marker integration in Primero, so it enables us two complementary types of evidence generation. On the quantitative side, we can generate reports with rich disaggregation, as we heard from Suman or in the earlier presentation. They are keen to see this disaggregated by the disability. So we can get rich disaggregation data, so disaggregation by location to identify the hotspot, by protection risk type, and also different demographic factors like sex, age, disability, as we talked, and then population status such as displaced person or refugees. And on the qualitative side, so it allows us for deeper analysis of climate markers through the regular supervision sessions, as well as the case management coordination meetings. So the combination of these quantitative and qualitative analysis, it ensures data quality, but it also helps to identify the capacity building needs. As we know, so it is very critical to have critical for caseworker to have this climate lens in their work to get this data right. And we also think it is very much necessary to overlay this data coming from Primero climate marker with other data that might come from disaster environment and climate agency to really enrich the understanding. Next slide, please. This is the example of the climate marker in Primero interface. So in the left screenshot, you can see is the example of the capturing climate context, and the screenshot in the right is one example of one of the markers on the linkages between climate and protection risk. Over to Stephanie.
So, do you hear me? Yes?
Yes.
Okay, sorry. So why does it matter? Well, climate markers matter on many fronts. And you see them here. It really supports our advocacy and our positioning, but it really, and going back to some of the points that colleagues had made about really telling the story of individual children and the individual experiences and the risk and the harms that they're confronted to due to climate change. So this is really a story that needs to be heard and that needs to inform our advocacy, our positioning. But also the climate marker really, we see incredible potential to really inform planning for preparedness and response, as well as informing policy development, resource mobilization, but also resource allocation, right? By tracking specific hotspots and vulnerable communities and families, we want to ensure that the resources are targeted towards the families and the groups that have the least capacities to cope. So in the next phase, it would be interesting, and hopefully in the next, maybe next year, we can have another presentation or an update. It would be interesting to see how the data generated by Primero can actually inform other critical data sources that disaster and climate actors are using, but also perhaps to think how we could use existing data sources to overlay this with some of the Primero vulnerability mapping and analysis that is being done. So this is maybe something to think, food for thought for the next phase, because the lessons are still unfolding. And the last point is to say that we wanted to convey that we're really seeing in the region a growing momentum with growing interests around climate markers. So there's countries, for example, you see here in the white box below, that Cambodia just released its NDC, so it's nationally determined contributions in September, which is it's one of the model NDCs that has been released so far. It's very child sensitive, and it explicitly identifies integrating climate marker as a key adaptation measure. So this is really one of the big wins that we've had in the region, but also to indicate that other countries are exploring the feasibility of integrating climate markers into their system, including, for example, China, which is currently exploring the modalities and the feasibility of doing so. So this completes our presentation. I don't know if there's any question. Let me see.
You are exactly on time.
On
Thank
time.
you very much. That was amazing work and an amazing addition to Primero. So we have one question, I think, from Samia, and I would appreciate it if Stephanie and Mohan, you could answer it in the chat, because we do not have much time for taking questions one by one. So thank you for the questions, and thank you, of course, for the presentation and the amazing work. So moving on with the third presentation of the session with colleagues from Ghana, Swims Insights, presented by Young. Young, can you hear us?
Absolutely. Can you hear me?
Yeah, I can hear you loud and clear.
Great.
The floor is yours, Young. Go ahead.
Thank you. Hello, everyone. I'm Young Julie. I'm a transportation specialist from UNICEF Ghana, and thank you so much for the opportunity to share the work from Ghana. I will be sharing how Ghana is using the SWIMS data analytics, not just for case recording, but also to inform the decision-making and system strengthening. Next slide, please. Great. So SWIM stands for Social Welfare Information Management System in Ghana. It's basically Primero-based CPMS Plus that has been contextualized in Ghana since 2021. UNICEF was the one who supported to introduce the system, but we have now fully migrated all data and also the ownership to the Ministry of Gender, Children and Social Protection since 2023. So it is an integral part of the child protection system strengthening approach that we are taking. Currently, there are over 52,000 cases recorded, entered by 1,200 users from the government and also non-government partners across 80% of the districts in the country. So this gives us a powerful national data set to analyze protection trends and guide action. Next slide, please. So now that we have a good data set, we started asking deeper questions. So what are the stories? What stories are the data telling us? Where are children most at risk? Who are these children? How are social workers responding? And what are their capacity gifts? Thank you for saying the same slide. So basically the aim is to move from counting cases or just reporting cases to measuring results and accountability, and to use that evidence to drive coaching, professionalization of the workforce, funding, creating opportunities for bigger investment and workforce planning. Next slide, please. So together with the Department of Social Welfare, who owns the SWIMS, we conducted a serious deep dive analysis using SWIMS data on the following thematic issues. So the first one was related to children without care peer. We analyzed 442 cases from 2 regions in Ghana, where there was the biggest number of children in institutional care, especially to understand of origin of these children, to understand where the children come from and prioritize reasons for gatekeeping activities. And we use this data analysis to develop the Ghana's national care reform roadmap, which clearly identify key priority regions for our intervention, and also attracted donor funding from the US and also from the UK. Second one was related to the sexual and gender-based violence. We can stay in the same slide, please. Thank you. So in 2024 only, we found that 3% of all cases reported in 2024 were related to sexual and gender-based violence, whereas the 78% were linked to socioeconomic vulnerabilities, mostly the social protection cases. Case closure rates were also extremely low. So we realized that it was 1% for the sexual and gender-based violence cases and 2% for the child marriage or adolescent pregnancy cases. We do know that this type of high-risk cases take time to close the case, but this still shows that there is a major gap in following up and also continuing providing the survivor support. So based on this, we initiated the SWIMS spot check and audit, especially targeting coaching support for underperforming districts. Third one was related to child labor. So we are currently analyzing nearly 1,400 cases tagged as child labor and trafficking to see if referrals or interventions are linked with specific supply chains like cocoa and gold, where Ghana is very famous for cocoa and gold. So we really want to understand, is there a specific risk related to child labor in this supply chains? And we are hoping that these findings will inform our private sector engagement and also improve business practices to be more responsible and sustainable in Ghana. The other thematic issues that we are currently looking into, and this is really a big thing because we are currently looking into analysis of 7,000 cases from 17 border and climate risk districts to understand how displacement, flooding, or drought or conflict affect child protection cases. Also to understand what types of cases are mostly affected by this type of emergencies. We do have currently the analytic report about the most affected type of cases, the most affected nationality, what was the major type of care arrangement, what was the major type of method of referral, what was the risk level, which is now being used to develop the new contingency planning for the child protection in emergency, and also informing our emergency programming. And lastly, we are looking into nutrition cases. We do have a very small cases, which is 168 cases, mentioning that malnutrition, tagged with malnutrition. So we're really looking into these cases to understand how social welfare connects with the nutrition interventions. This is an area where we want to strengthen further to demonstrate the need from the health and nutrition sector and health and nutrition focused donor to invest in social workers. Next slide, please. So as, excuse me. So I wanted to really emphasize that this analysis is not really an academic or theory-based exercise. This is really directly to have a impact at the program level. So this data will inform how Ghana manage its child protection and social welfare cases. And at the system level, we know that now the SWIMS data is now used as a government district performance assessment as a means of verification to assess their performance level. At the practical level, now the data is used to identify district needs, especially on coaching, supervision, and professionalization. At the accountability level, data is improving the transparency on case follow-up and closure rate, but really at the planning and costing level, where we are really trying to make more stride. It fits into the investment cases and resource allocations discussions that we are now having in Ghana. By 2027, we hope that SWIMS is scaled up to every part of the country, so all 261 districts. And we're really hoping that the SWIMS data is not just numbers, it really shows that where our systems are strong, where they are weak, and where children still fell through the cracks. And by grounding our planning and accountability in evidence, Ghana is committed to turn data into action for every child, and I really encourage other countries to also share their experiences of turning data into actions, and also exchange best practices and innovative ideas for our mutual learning. Thank you so much.
Thank you very much, Young. So we still have some minutes to spare. So for any questions, please raise your hand, put them in the chat. I'm looking at the chat right now, so I'm using multiple screens. Yeah, I cannot see any questions. Social welfare information management system for Samia.
Correct.
I've done my homework a little bit. So yeah, any other questions? If not, we can move forward with the final presentation of this session, which will be presented by the amazing Jan to show us the Primero Global Dashboard. No more questions, I'm assuming. No hands raised. So yeah, Jan, the floor is yours.
Wonderful. Thank you, Ali, and thank you, everyone. So if I haven't met you, I'm Jan Panchalingam, and I'm the Primero deployment lead based out of headquarters, and really excited just to be here and show you this next presentation, because it's going to lead us also into the following session, which I will be facilitating on the product itself and all of the exciting things that are happening within the product. So the thing that I typically am doing, is I'm working very closely with system administrators. I am making sure that they are feeling comfortable and confident in the product, and wanting to make sure that we're able to turn on various features and functionality that not only help caseworkers and supervisors, but also help with monitoring and evaluation of the teams and all of the programs. And so one of the things that I'd been doing for the last several years with the system administrators is aggregating this information into a dashboard. So what you're seeing on our screen, on my screen, is our internal UNICEF site, which we can share with you. You just need to be provisioned access if you're not in UNICEF, but essentially it has all of the robust information that you're hearing about today, and more in particular, all of the summary on the Primero instances. The wonderful regional focal points that you see on the call, Ali, Simone, Mohan, Isaiah, Mamadou, like this is what we're working on across the world in different time zones. And we want to make sure that there's one place that everyone can go to in your different organizations to come and find this information. So the thing I wanted to show you was not only do we have this site which links into the different regions and you can get more robust information, but this was the Power BI that previously we were using and sharing as aggregate information. So you would have a snapshot of open and closed cases, the number of users, the number of instances, and how that scale is showing. And really, we've been using this more as a tool for our business model. model. This is what we use to set the pricing or helps in setting the pricing for the subscriptions. And now the thing that I want to show you is how we've evolved this aggregate dashboard into something that you will be getting access to shortly. So in the last week, we finally got the right licenses, and we've put together a global dashboard. But to be able to develop this dashboard and to bring in the content, we have to solicit this information from country offices and partners. We on the Primero team do not have access to production sites, so this information is only as good as the information that we receive in it. If we do not receive that information, then it is not collected. So in general, it's always underreported because we don't get the information in a timely manner or accurately for various reasons. And so one of the things that we've built into the system that system administrators now have access to is called the usage report. So I'm just logged into one of our demo sites, and this is under the settings, and typically it's only the system administrator that has access to this, and it's the last tab in the settings section. They're able to select export, select a to and from date. So I'm just going to do this in real time just to show you how this works. And we're going to call this your Q3 quarterly stats report. An export will then download to your device. And this is what I've been asking system administrators to email to me, and then I aggregate it using this Python compiler for the dashboard. This information includes what the website URL is, the dates, the quarter, as well as the total number of agencies who are active on your implementation, which modules are enabled, and then a breakdown of users by agency, so active and disabled, and any that are new this quarter. So this user information is also really great as a system administrator to really manage how many users you have in different organizations, to see who you need to maybe disable, to follow up with various organizations. And this is something that we're going to iteratively improve on. Then within each tab, you'll have information on the actual case statistics. So you'll have total number of cases that are open and closed, as well as information on what's happened within that quarter, total services that have been provided in that time, follow-ups and incidents as well. And this is what's aggregated into what I'm going to show you now. So the new dashboard is a little bit of a dark mode, and with my older eyes, I feel like it's nicer to look at than the white that I was previously creating. But this is what you will eventually get access to. You'll be able to filter by country for CPIMS Plus only, not for GBV or MRM, as well as for the module and your dates. So in this case, this is the first iteration, so there needs to be a few improvements. We actually have 70 countries, and we're with the data that's being received at this point, we have an average closure rate of 25%, and on average, each caseworker is managing 91 cases. So you'll also see that there's a map that you can click into and see where different modules are enabled. And then the key information is, since going live, you can see the growing trend of total cases and closed cases. We're currently case managing almost 1.9 million cases across all modules in the system, as well as you can see the growing trend of incidents and users. And so we have roughly around 19,000 users across all of the various agencies. And I'm going to get into that in just a second. And then lastly, just at the bottom of the dashboard, we always want to highlight our resources and our social media, because it's our way to communicate and share everything that you're hearing, especially in this very interesting session from all of the different partners, where we share things about the climate indicators or the child functioning module. And I'll get more into that later. But we have our YouTube subscribers, and actually in the last week, we hit 1,000 subscribers, which was really exciting. We have an Instagram where we try to showcase stories from all of your programs. We have a newsletter, which goes out every quarter, and then our support hub, which we're going to show more in detail tomorrow, which has had a bit of a facelift. In addition, we're also now showing breakdown by user agency. So it's been really hard to do this for specific governments. Robert mentioned this earlier in the year in review, but you're able to see for Save the Children, for example, we have nearly just over 6,000 users. So it's just not updating fast enough. 4,000 users. Or for IRC, we have just over 2,000 users. And so this is really great for us to be able to see which organizations are predominantly using the system, who we need to invest in, and make sure we're bringing them into our coordination meetings to make sure that we're able to coordinate effectively with them. So this will be shared with you eventually. We're just doing a little bit more of a pass at this, and it's going to be hosted on the support hub. And of course, that export that I was sharing earlier, in every release, we're going to be iteratively improving these. And so if you also have any suggestions that you would like us to bake back into the dashboard or into these usage reports that improve your monitoring and program insights, then we'd be very happy to do that as well. Thanks. That's all from my side.
Thank you very much, John. I know I will be using that dashboard a lot. So yeah, and one last thing to wrap up this session. Thank you everyone for attending, and thank you for the presenters for their amazing work. One last thing to mention is to do not forget to vote through the link that I've put in the chat for you, the most relevant or your favorite contestants' work presented today, and the winner will be getting a custom branding for their instance, which will be discussed later. And yeah, thank you very much for attending, and have a, or I will be handing over to the next, or to you, Robert, maybe. Yeah, come, please, Robert.
I just wanted to jump in because we have to be very, clear about the instructions for the voting. You can only vote once, okay? Only vote once. And the reason that I'm saying this is because I went and I looked at the results from the previous round, and there were more votes than there were people on the webinar, substantially more, in fact. And so I'm going to take this moment, because we were going to save this for the final part of the day, but just because it's a little bit funny, and it's a good lesson to learn about, like, being clear about your instructions, right? Requirements that have to be very, very clear. I'm going to share with you the winner of the previous session on the Ignites. And so I think you can see my screen here, right? So the winner is Shakil's presentation on the Pakistan journey of the CPIMS, with 80% of the votes and 148 submissions. So I think he had some real hardcore supporters. It was an excellent presentation, and we will fully live up to our commitment to provide the prize to. Oh, it's even gone up since we spoke. And well done to CPIMS and Shakil. I know Shakil presented at the last year's meeting on the FRAPI, the data challenge work that they did, and they didn't win last year in the voting, but this year, congratulations to the Pakistan Country Office team for their work, and to Shakil's presentation for a thunderous landslide victory in the first vote. We won't go into the second vote until we come back. We're going to take a break for a few minutes now, give everybody a chance to rest, walk around, bio break, grab a coffee, whatever. Things are going very, very well, I have to say. I'm very happy with the questions, with the engagement. The presentations have been absolutely fantastic. A great session. Everybody, really excellent work. We can see the buzz and the energy coming. So what I do want to do is make sure that we take another look at this at the whiteboard. We don't want to finish 2 days of the global meeting together and not have any documented outputs from it. So that link is right here in the agenda. You should be able to navigate to it. I've opened it up, so let me just double check. I already see a little bit of activity in there, but really, as things occur to you, we want you to document them here, right? Things that you want, things that you need, things that you're learning. All of this becomes incredibly valuable for us for the next year of planning. So please, over the next 15 minutes, we'll give you a break, but please do come back to the whiteboard. Make sure you add any thoughts or ideas that you have there. And thanks very much to all the presenters and to Ali for facilitating us on that one. What we're going to do now is, because we're getting towards the end of the session, we still have Jan is going to lead us through some product demos with our colleague Jack. This is good stuff. You're going to want to see it. These are new features, things that are being developed on the platform. So we're going to shorten that session just a little bit so that we can end promptly on time at 6 p.m. CET, so less than an hour from now. So everybody, you can take, we're going to have a nice 10-minute break. We're going to have a 10-minute break. During that time, I'm going to put a video on. It's only in case you want to watch it, nothing mandatory, but I thought people might like to see some of the videos that were compiled from last year's global meeting. So we'll consider this session closed. We'll keep the line open, and we'll convene back in 10 minutes. And in the meantime, I'm going to play a video for those of you who are still sitting at your computers and want to just watch this. 10 minutes. Jan, I want to play the Nankali video. Is it linked here?
Nope, we'll grab that and put it in the chat. Sorry.
No problem. This was filmed and edited and put together by our colleague Nikolai, who is our champion in Moldova. Nikolai, I don't know if you're still on with us or not, but you deserve a great thank you for putting this together. Really, really great communications pieces that Nikolai has recorded and edited for us. I think I can find it too.
I just pinged it to you. Oh, sorry, I should have put it here. Let me put it in the chat.
Yeah, put it in the chat and then I can play it for everyone. And we'll set a 10-minute timer and come back refreshed and for the final session. I have to reshare.
Sorry, nothing's playing on our side. And just while Robert's sorting that out, I just wanted to say on the whiteboard, it does seem that it doesn't work for anyone outside of UNICEF, and we can't actually bypass that. So please do put your feedback into the chat. And if you don't feel comfortable with that, just let me know, and I'm also happy to quickly put together another anonymous poll if that works easier. Thanks, everyone.
That whiteboard should work for everybody who's registered for the webinar. Is what it says. Anyway, we'll figure it out.
My name is Nankali Matsud, and I'm the Regional Advisor for Child Protection in East and Southern Africa. First of all, I just want to start off by congratulating the Primero team that it's the 10th birthday So happy birthday to all the Primero team. I think it's an amazing achievement to have gotten to 10 years. This system for me is very important. I was sharing in plenary that 3 weeks ago I visited Zanzibar and met with a government representative that was talking about Primero. She was talking about, and specifically not just a government representative, but a minister whose portfolio is around addressing issues to do with children. She said Primero for her made a huge difference. And I want to share that experience because I think that shows the added value of Primero. She says from her desk and from her computer, she's able to determine the caseload for for child protection in Zanzibar. Before Primero, she was able to make broad statements about child protection, about how severe it is within Zanzibar, but she couldn't give numbers behind it. Yes. And so Primero is giving her numbers. That means that if she has to go and engage in parliament or during budget discussions, she's able to give a specific number of children who have been affected and then make a case as to why we need to have those policies in place to protect those children. And she's also able to use that to make a case in terms of financing. So Primero enables, senior government representatives to be able to plan, to be able to develop policies around issues to do with child protection. But then looking downwards, she said that it enables her to be able to identify which provinces and which districts are affected. Yeah. And so if she's planning, in the next months, which provinces it is that she needs to go to, she's able to look at the database and look at the figures and determine where there's the most need. And then she can be able to identify those are the places where she should go to, those are the places that should receive a certain level of funding. And also she's able to identify which caseworkers are perhaps performing, not performing, why are the cases coming in or out. And when she goes out there, again, because of Primero, they can sit down as a team, of social workers together with her and look at the caseload, identify what are the different child protection cases that are affecting particular areas more of or less of, and then identify what it is that needs to be done in terms of response. So Primero for me, in its 10th year, is a great system because it's able to support in terms of policy, in terms of financing. But I think at the ground level, and most importantly, is that it's able to lead to responding to issues for children on child protection.
Maybe you heard about some concerns from the governments or other entities who want to use it, but they have something what is obstacles. And most of them are just really not obstacles. Maybe you heard some what people say and think about this.
Yeah, I think as UNICEF, we've brought about an innovation that has been able to make a huge change for the child protection sector. And for that, we should be really proud, and that it's also gone over 10 years. But then it's 10 years old. And, if you were to compare that to a child, that's only at very early years. And so there's a number of issues that we still have. We know that in a number of countries, especially where you have issues to do with digital infrastructure, Primero is going to be challenged. And so it's important as we think about, and I think this workshop is really important because it's starting to look at how do we scale up? How do we ensure that Primero is a part of government digital infrastructure systems? So those are the type of things that we need to be able to think about. Again, just going back to the case of this minister in Zanzibar, she was talking about lack of computers. Yes. She was talking about digital skills amongst our social workers. But I think what we know, at the core is that Primero is an enabler, or the digital capacity. It enables a child protection system, but it doesn't stand alone. You need to be able to build the entire system for it to really be able to work. So you need to be able to have enough social workers, you need to have trained social workers, and increasingly, of course, now as we're going into the modern world, they need to be social workers with digital capacities and competencies, and then with the right tools as well. And so as we think about Primero, it shouldn't be as a standalone, but it's an investment that is required system-wide for it to be able to work in addition to many other components of the child protection system.
And actually, it's a good investment compared to what brings value to the country. You can invest in other things, but compared to what you can invest, actually, Primero, I assume it's a much less investment compared to other infrastructure or other things governments are trying.
So, first of all, just basic, we came from a place and a number of our social workers are still using papers and pens. And so, Primero makes a huge difference because it's shifting us away from that. So that just in itself is huge. It's enabling us, it's modernizing us as a sector, and that cannot be undervalued. You can't, place no value to that. That's particularly important. We see other sectors, health, education, etc., who have been digitalized many years ago and are learning a lot of lessons, and we're learning from them as well as we come into this space. And now, another thing that we've also been talking about is the issue of climate change that is impacting significantly on a number of the countries that we have. And so being able to have this digital component ensures that we're able to maintain our records, keep our records, and have a better focus on children. And so when it comes to governments thinking about where they should invest, for me, there's no doubt that Primero is an important place for them to invest in finance.
And it's a scale. It can be implemented to the whole country. Can it be trained for how many caseworkers?
We started the workshop today talking about, tens of thousands. We're talking about, I think, I can't remember the number of countries, but for us within the Eastern Southern Africa region, we have 9 countries that have all, committed towards implementation of Primero. It's starting up small. It should start up small.
Yes.
But this is something that we, the vision that we all have is that it needs to be able to go to scale. Too many children are sitting outside case management systems. We have a world where we have increasing vulnerability, and we need to be able to have a system that can capture, can design a response, and can be able to respond to those children.
Okay.
Yeah.
Thank you. Thank you.
Hello, colleagues. We'll be coming back now in the next minute to resume. Just to prove it, I'll let you hear my alarm. That was 10 minutes. This is the final session. Lots of good stuff worth sticking around for. Jan, whenever you're ready, you can take it away.
Yeah, I'll start with actually just answering Samia's question. So the whiteboard is for us to do our planning for the next year. For those of you who have not been a part of our previous annual meetings, whether it's in person, I think once we did it virtually, but otherwise it's been in person. We typically are collecting feedback throughout the days that we have the in-person meeting, and that's what we use to determine what are our priorities for the next year. And so the whiteboard is our way of getting feedback from you on what should be prioritized. So I have confirmed that it is going to be difficult for non-UNICEF staff to access the whiteboard. So if you do have feedback for us, please put it in the chat. If you feel that it needs to be anonymous, then you can let me know and we can put together a quick survey to get that feedback as well. But we're very happy to hear anything that you have to say for us to be able to make sure we're planning to improve our programs for you. So I just wanted to start with that. So I am starting the last session for today, and I'm very excited to be doing this with Jack Mazenzen from Salus, who is joining me. But I'm going to be getting started with product demonstrations. So I kind of already did part of the demonstration that I was going to do now in my last session, and that was the usage reports and the global dashboard. So a few other things that I wanted to walk through with you today is, well, firstly is our Primero added services. So I want to first start off with this, and Suman, sorry, mentioned this. She said something about how it's just served on a plate, and we're able to quickly implement the child functioning module into the system, and it was something that came with guidance, training, all of the coordination that she needed to be able to get it set up in her system and then go with it. And that was the impetus of developing something that we call the Primero Value-Added Services menu. So if you click into that document, you should see something that looks like this, and I'll quickly just share my screen for those of you who do not know about it. And it has what these different value-added services that we offer, that all of the various Primero team members are able to help in delivering. And so this document outlines what is it that we can offer and the costing around that. So you already heard about the child functioning module. And so there's a lot more detail around what is included in that service, as well as the costing that we include if this is something that you want. We also have Power BI dashboards. So a lot of organizations may hire consultants or different organizations or vendors to develop these Power BI dashboards. But this is now something that we have in our toolbox to be able to do for you and help you. And then you don't have to set up your own contracts yourself to be able to deliver this. The other items on the list are responsible data for children. And this is an initiative that was coming out of UNICEF, and you can find more details around it here, as well as we want to show you some palettes and branding, which I'm going to get into in today's demonstration. And then interoperability, the thing that makes us actually significant and be able to connect with different systems for service provision, for visualizations, for really for the e-referral pathways, for Rapid Pro and messaging. Everything is on the crux of how important and scalable we are because of interoperability. And that is something that we can do and deliver for you. And we've done it time and time again in multiple places. So if you have any questions about these different value-added services, please let me know. The more recent one that we have added is we have been able to also integrate with Rapid Pro, and Rapid Pro is also a UNICEF product. And so there's some costing and things around there if this is something of interest to you in your programs. So with that said, I'll get into the first feature I wanted to show you. So this is just a demo site. It looks probably like most of the demo sites that you have seen if you are familiar with Primero. And within every case file, there's a section called Other Documents. And this is where you will upload various XLS files or doc files or PDFs. And one thing that we're really excited about, and this is brand new, is that previously, if you were to view any of the documents that you upload into the system, you would have to download it to your device first and then view it. And really that there's a lot of concerns around downloading the information to your device and maybe not deleting it. Maybe there's like a slowness in downloading it and it's slowing things down. So now one of the things we've done is have this embedded viewer. You can do this for various types of documents. You can now click on your document and you can see it in app. We're really excited about this because you can also use Adobe, or sorry, not Adobe, but the Adobe type of features where you can find things in your document. So if I wanted to use the search icon within this and I wanted to type in social services or something like that, it will find all of the matches and find exactly what you're looking for. You're able to zoom in and out of the document. So a lot of people may not have Adobe readers on their devices, so you can quickly look at this information. And one of the other things which is nice is we actually baked in some of the features where you can highlight information within these documents. You can write and add in your comments. You can print PDF and you can obviously save. And there's a lot of other different tooling that we have here. Any changes that you make into these different documents using these tools must be saved to your device and then re-uploaded. They do not just save automatically, but this is something that we're really excited for various data protection reasons that it's now been included in Primero. And soon we'll be able to do this with more and more types. We've done this with essentially all of the different types of documents that people have been uploading into the system as we've been soliciting advice from your programs. But we would also like to refine this more. So if there are other types of documents that you see that you want to be able to preview, please let us know because we'd love to be able to improve this functionality. But this has been a long time coming and we're really excited to have this embedded in the system. The next thing I wanted to show, sorry, just want to double check, is the audit log. So we've enhanced the way we are doing security. We've made a lot of improvements over the last 6 months in terms of having the audit log be really trackable and traceable. If there was ever a data breach, if there were ever any sort of issues that need to be monitored. So what I mean by that is now, as a system administrator, you're able to see everything that's tracked in the system, by whom, what any user has done in the system, and you can filter those, not only by the time, but by the user themselves, as well as their actions. So logging in and out, creating, updating cases, accepting and rejecting transfers, referrals, assignments, etc. And so this is a really good tool to be able to delve into details if you need to troubleshoot things as a system administrator. But really, this is from a data protection perspective, we're able to be a lot more transparent and everything is tracked. Of course, you may have already known this. On every case, you also have a change log. This is not a new feature, but I just wanted to make sure that you know that there is also a change log that's in every single case, where you're able to filter by the specific form themselves or a field and hit apply, and you're able to see all of the different tracked changes and who made those changes on your change log, which has been really useful for especially changing assessments. We don't want people to have assessment 1, assessment 2. This is our tool that tracks all of the changes that have been made on a child's case, and you can look into those details. And this functionality is available in both CP IMS Plus and GBB IMS Plus. We also have another feature that we had released, which is called the access log. This shows all of the users that do not have access to this case, like they are not the record owner, and what they've done on this case. So I'm just demoing the system. So you can see that I'm viewing and modifying this case, but I'm actually not the record owner. So the record owner and others who have the correct privileges based on their role-based access can see who are the people looking at my files. So you can see if it's your manager, you can see if it's just the caseworker who is assigned, and you can update the privileges as necessary. Also, this is a really good tool for service provision and making sure your service providers are accurately accessing these records and updating them appropriately. And you can see if people are just modifying the cases and if they're just viewing the cases. Also, if you have any questions about this, please put your questions in the chat and I'll answer them as we go. The branding that I wanted to show you is something that we're really excited about, especially for government implementations. This is our Salus who Jack works for, and this is one of their demo sites, which I think is a really nice representation of the gradient background that we have. We also can change the logos. You can see in the top right-hand corner of the screen. You can also do pictures behind your login screens. And this is the type of branding that we want to make sure is available to you. So it's your ownership. We don't have access to your production sites. This is your tool. And this is something else that we are now offering for all implementations and looking forward to rolling this out more systematically for those who are interested. And this is part of the value-added services. So with that said, I'm just going to stop sharing my screen and hand over to my colleague Jack, who's going to take over and do the next demo for us.
Okay, sounds good. Thanks, Jan. So hi, for anybody who I haven't met before, my name is Jack. I work for Salus, and I handle implementations and requirements, basically working with the needs that kind of you'll communicate to Jan from your day-to-day work and figuring out how to make that work within the app. So what I'm going to show you is a feature that we developed for one of our clients in the US and Canada, which is actually the feature addresses a need that we've actually heard before from some of our UNICEF-based implementations, which is sort of this question of how would we ever give our sort of beneficiaries access to this system? Now, a lot of places this may not be relevant, but in particular for settings where we're doing submitting feedback and things like that, or if you want a beneficiary to be able to fill out a survey on their experience, you may want them to be able to access and update their own case. There is also a really strong use case here for just a right of an individual to access their data that is being collected. So this specific use case that we have here was for an organization that provides job training and placement in Canada. So what is different here? So first of all, you can see sort of the branding changes that Jan just mentioned, because this is a Salus site. But you're also going to notice that here in the login page, right under forgot your password, there's a link that says register. Now what I'll do is I'm going to put in my email, and I'm going to add a number there because I've been testing this a lot. I'm going to put in my email. I'm just signing up. I'm going to put in my name. I'll select my preferred language. I am going to indicate whether I want email notifications, and I also have to give my consent for whatever organization this is to collect and process my data. When I do this, I'm going to get a little notification basically saying, hey, please verify that email address that you put in. And once I've done that, that is going to allow me to basically create a case for myself, or sort of submit information that lets me access my own case. Just give me 1 second. I'm just changing which screen I'm sharing. If you look here, This is the password reset email I get. This is just like the password reset email you would get anytime somebody creates a Primero account for you. When I click this, I get to set my password. And once I do this, I now have an account in the system, but you'll notice that really the only thing I'm able to access is My Case. So this looks very similar to the My Cases tab you would usually see if you're just a social worker on the system. But I'm never going to be able to access anybody else's case except my own. This is very, very siloed. And so because, I am signing up for services, basically what I'm going to do is I'm just going to give my name. I'm going to do basic demographic information. So I'll give my date of birth. Do that. And there's a number of fields in here that are particularly relevant for if you are doing job placement, which again, that's what this organization does. So I'll just say I'm looking for work. I can give my address. And here our locations are just sort of Canadian provinces and US states. So if I save this, now this is just a sort of a standard case within Primero that a caseworker is going to be able to go triage. But as somebody updates my case and as they move through the workflow process, as through the different workflow steps, I can come in and I can either check to make sure that, maybe I need to wait to see if I'm being accepted into this program. Or maybe I need to update some of my information. So for instance, the participants in this program end up going through job training. And so I may need to fill out information on the classes that I'm taking and the certification that I'm trying to get. Any questions about this so far? I don't have an eye on the chat, but I know I just went through a bunch of stuff that's very new in the system.
No questions so far.
Okay. So let me see. So give me 1 second. I'm just going to go in with my standard account. One thing that you will also notice about these cases is we have set up a new status within the system for cases that are not yet undergoing active case management. So I've got my standard kind of status filter here, where in progress is what we would usually think of as our open status. But what we've encountered more and more is that we now have a lot of situations where people aren't automatically going into case management, especially if they're applying for services with your program. Frankly, a lot of times their application may be rejected or they may not be appropriate for your organization and they need to be transferred outside of the system to someone else. So we've actually built a dashboard around this, but you can see these are all cases that are in that initial intake step. So this is sort of another feature that you can take advantage of if your organization has this kind of workflow where before cases are entering active case management, they're in this intermediary step. This just sort of lets you triage that. Any questions about that?
Two things that I would say, Jack, that I think for everybody to understand the relevance, that we have two important functionalities for the first time. The first one is around data subject rights and around the ability to access your own information and even seek redress for your own information. And up until this feature was developed, we really didn't know how we would be able to implement that in Primero. Now we have the basic functionality to allow us to do that, and we're going to have to continue to work on it, but this is really promising and exciting. So that's great news. The second part, I think, is for particularly, I'm thinking for the linkages between child protection, gender-based violence, and social protection programs. And in many places, social protection programs are programs that people, families can enroll in. And it doesn't mean that it's automatic, but it does allow us to at least consider that as an opportunity and a new use case going forward, the idea that individuals could enroll for programs. So I think very promising stuff, and looking forward to seeing it in action.
Yeah, no, we're really excited about this. I mean, this is when we sort of figured out how to put this in action. We're very excited about all the doors this opens up.
Jack, we did have some questions in the chat, and I know you've said this, but maybe just to be a bit more clear. So one of them is, so who fills this out in terms of the data, and how will the caseworker get access to this, and will it set up a case code once saved?
Yeah, so I mean, you can see that this is the case that well, let me answer one question at a time. Who fills this out? The answer is that the client themselves fills this out. Sort of you just saw, I mean, I can go back in as this user. So, you know, the way we've set this up, your username is basically just your email address. When I go in here, I'm just taken to my case, and this is all information that I filled out myself, right? Like, basically the way we have this set up, if you are an administrator and you're used to dealing with Primero's roles, anytime somebody signs up through that registration page, they get a user account that has a specific role, which can only access the My Case page and only has access to certain forms, right? So if you were looking at setting this up as an administrator, you would have a specific role and you would say, we want them to fill out the profile form, and maybe there's an additional form that says application for services or something like that. But I do this all on my own. And then you can see up here, there is a case code generated for this. It functions like any other case in the system. In terms of how a caseworker would get access to this, what we have done in this particular instance is all of these cases and all these users go into a user group, a preset user group in the system for the self-registration clients. And then what you would need to figure out, and this is a bit of a process thing on the organization side, is what users are going to be the ones going in and triaging these cases. Because it's not like, you know, it's not like Jan is a caseworker and Jan automatically gets assigned all these cases, right? Someone needs to come and determine, is this case getting assigned to Jan? Is this case getting assigned to Robert? Who's doing that? And so what we've done in this particular instance is the users that come into the system, they have an account and they have a specific dashboard that says, hey, these are new identified cases. Basically, you know, these are the ones that are self-registered. At that point, you can go in and you can just reassign it to whoever is going to be managing it. I hope I answered all those questions.
Great, thanks, Jack. And Sam, if anything was unclear, just let us know. Mohan, please go ahead.
Sorry, that was accident.
Okay, no. So
what time is it there, Mohan?
10:30 p.m.
So I think that if there are no more questions, when it comes to the product, we share everything on the support hub, as well as over email to all the system administrators. And these are all of the features and functionalities that come out and are available to you every 2 weeks. So if you have any questions about the products and any of the new features, I would highly suggest just to go to the support hub. Please note too that we're going to be having, the facelift of the support hub that's coming out very soon. And Jack, there is some questions coming through the chat, so I'll just get you to answer in the chat as we transition into the wrap up. Thanks so much, everyone.
Sure. Different from the function of a case manager or case supervisor. So, David, I just want to ask: do you mean the ability to triage those cases that are coming in?
Yes, exactly.
So I'll tell you where it's similar, which is that these users that we've set up, they can see everything in their user groups. They have that same group level access, right? What's different is that, first of all, we've never had it before where the person receiving services, the beneficiary, the client, whatever you want to call them, is signing up for those services themselves. The second thing is, basically they're because nobody is registering this case, the record owner is essentially, when you start off, this is very technical. I don't know if this is interesting at all. But the record owner is that same user account that they got given when they signed up. And so maybe I can illustrate this a bit. So let me see. I'm going to try to log in as this user. Great. Okay, yeah. Let me just. I think I sort of skipped over signing in as this user to begin with, and maybe that'll just make things a little bit easier. So do you see this? This is the person who would be going through and checking all of those self-registration cases, right? You can see I have this dashboard here that says you've got 4 identified cases. If I click through there, you can see this is the case I created when I signed up, right? And in the social worker column, this is basically that record owner. This is Bill Smith's account, right? Like this is that person, that beneficiary who's signing up for services, right? But then once I go in, I can sort of looks like I don't have this permission, but I could reassign this to whoever's actually going to be managing this case. I don't know if that answers the question at all.
It does to some extent.
Okay. Is there? Go on. If you have other questions, I'm more than happy to answer.
No, I guess I'm just trying to, make it fit into what we have been used to doing.
Right. Yeah, no, I mean, it's definitely a different workflow. Something that is very clearly different here is that, from day one, we sort of always operated on a very basic understanding of, there is one person who is responsible for every single case, right? And I think that is still, for the most part, what is going to happen in most programs. However, we have encountered this before, and actually, I remember this came with TSAV at one point, where a lot of times when an organization first comes into, when a case first comes into an organization, there is no specific person who is automatically responsible for it, and people are sort of coming in and deciding, again, triaging and assigning that case to somebody. Doesn't happen with all organizations, but we have seen it before. And so this is an example of that.
And it's completely configurable, and it's not obligatory in any way. It's something that can be used if necessary. So it shouldn't conflict with any of the roles that you're currently using, David. It's just a new use case for intake.
Yeah, thank you. I get it now.
So I see, Ali, you have your hand up.
Yeah, thank you, Jack, for this presentation. And I really am with you. This is a great idea to be added. And I have seen some similar interfaces where beneficiaries can register themselves for services, specifically in Europe when they apply for international protection or temporary protection. There are some such interfaces where they register for them. But those persons are usually adults understanding exactly what are the services that will be provided to them through registering, what are the processes that they need to go through. So I'm talking from a child protection perspective. So the beneficiaries here are children under 18. Do they understand what case management is? So, and they register, and especially in humanitarian contexts where there are different services other than case management that are being provided, especially distribution and financial services, that livelihood services. So this is the concern. I mean, if utilized in the correct way, I think it's a great idea. But yeah, the type of people who would be applying for this in child protection, it's hardly likely that they understand what case management is actually.
That makes sense. And I know that this is, we've kind of run into this before with, how you collect consent and whether somebody at that age can actually give informed consent. I will say that for this program, this is pretty much all adults, right? These are people who have graduated high school, and I believe the exact program they're applying for is training in how to be an airplane mechanic. So this program in particular is specifically not for children. And Sao-san, I see your question in the chat. To that point, this organization does provide a lot of services. This self-registration flow is specifically for that job placement program. There are some sort of related services that this organization does provide to these job seekers, but it is primarily for job training placement.
Great, thank you, Jack. And if anyone has any more questions for Jack, please let us know in the chat. This is a new feature, and like everyone has said, this is really potentially not for children, but may have other use cases. So exactly, it's just Robert said in the chat, if you have any contacts where we can adapt this, please let us know, because this is so new for us as well. So thank you so much, Jack. We are going to wrap this session, and I'm going to hand over to my colleague Mamadou from West and Central Africa, our regional focal point, fantastic regional focal point, who's just juggling so much, and our Power BI guru to take us into the wrap up for today. Thanks so much.
Thank you, Jan. I think we just have a few minutes before the end of the day, so I'm going very quickly to give you a brief overview of what we do today, and we will have a Mentimeter word cloud just in 2 or 3 minutes. Today, we began the Primero kickoff reflecting the progress we made, the lesson we learned, and our continue to grow stronger as a global community focused on sustainability and scale. We then move to the country experience, where 5 countries share example of how Primero is making difference. We start with Palestine, with interagency CPIMS Plus. Ethiopia is scaling up the CPIMS nationally, the multi-country GPV IMS initiative, where we see data in action. Indonesia with a Symphony, and finally with Pakistan, showcasing CPIMS Plus across 4 provinces and being voted as the winner of today's session. And next come the Primero Data Challenge 2025, with excellent presentation from Timor-Leste. They introduced the child functioning module, East Asia and Pacific on Climate Maker, Ghana, with insight from SWIMS, and finally, the global Primero dashboard, a real highlight of the day. From my side, I think this is a highlight of the day, giving us an initial view of Primero global data. And we finished with our last session, and we see improved report and document preview, access log and user support tools, and a fresh new branding look. And the last one with Jack, we see the self-registration module. And before leaving, I think I just have 5 minutes again. We will ask you to connect on menti.com, and I can share my screen. Okay. A minute, please. I will share the address and the password with you. You can join the menti.com and use the password 85722857. Normally, if you